first chapter. So it is very historic. Why? Because this is the first extension, first date we have announced. Therefore, nowhere in India we have made announcement. This is the first announcement. Therefore, it's very historic, and it's his dedication, commitment to the cause of sports, and we see that his association with us, partnership with us, it will help the growth of sports, and we are able to bring all the industry professionals into one platform. Thank you for willingly accepting our offer as well. Thank you. Yeah. Neeraj Jha is our honorary Secretary General in the Association for Sports Industry Professionals. We have now 1,400 plus members last 6 months, and we will announce something positive for taking forward this journey in contributing for the growth of sports industry in India. We have on 18th we have a board meeting, and hope to share all the developments from there with you all. And I would urge everyone join Sarthak and ASIP and Sports Science India. Let's build a force so that we have a bigger voice to bring about bigger change in the sporting ecosystem in India. Thank you.
Thank you, sir, for this lovely opportunity. It's a new thing for me, but I'll surely try to prove it. And I'm very happy to make this, announcement over here, because we have some experts over here in front. Mr. Rajaram sir is there. Journalist, Mr. Dr. Mukta is there. He's one of the senior physiotherapists, sports physiotherapist of the city. I think the XIMB professors are over there, the sports management chapter. Dr. Ganeshan is one of the very senior sports physiotherapist who was in Tamil Nadu, and now he takes care of one of the organization of the Bhavina Bindra group. So that's great. And then we have the sports nutritionist ma'am is there, Sunita ma'am, Anjana ma'am, Dr. Amit Bandopadhyay is from the West Bengal Sports Association Medicine, so he's also there. And we have that coach, Dharma Rao sir is one of his national coach, and many of his students are in the panel, and also senior physiotherapist like on top of them, this our yoga teacher instructor madam, and Pushpanjali ma'am is there, and all my favorite, my senior, the athletic Bafoji sir, Surinder Dina Suri sir is there. So it's a very nice platform. I think we will try to learn more about it and we'll surely point it out. Thank you, sir. Thank you. Sunita ma'am. Sunita ma'am, so talk about. So we will have a next session on sports nutrition. Unfortunately, the other speakers couldn't make it due to the Indigo glitches, and एक दो तीनों का फ्लाइट कैंसिल हो गया, तो हिस्से इज द लोन वॉरियर. जितना भी न्यूट्रिशन अभी आप खाए हो सबका कैलोरी डिटेल्स यू कैन आस्क कर.
Welcome back. So here we will be starting our next session, which is one of the most interesting session also on sports nutrition. We have our guest, Dr. Sunita Sahu. I'm privileged to introduce her. Chief Clinical Dietitian at Apollo Hospital, Bhubaneswar, with over 19 years of experience in hospital industry with special interest in critical care, onco-nutrition, sports and wellness overall. She is also listed among the best 10 dietitians of India 2023 by drugresearch.in. Ma'am is a certified sports nutrition and FSSI certified internal auditor for food safety. Ma'am, we are honored to have you on stage. Over to you.
Namaste and Jai Jagannath. Hope you all are alert after a good lunch. And Sarthak sir has asked everyone how was the lunch. How was the lunch? And what did you eat today? Fish, protein, okay. Okay, and other things? Fish is protein, then? Rice, chapati, naan, किसी ने नहीं खाया? Carbohydrates, good. And other things? Side में जो salad था? Fibers, okay. Dessert किन किन लोगों ने खाया? मैंने कुछ लोगों को, मेरे डाइटिशियन को देखा जम के खाया. Okay, I have slides, please. I have prepared as 3 other dietitians were also there. So, sir has asked me to speak on food or diet for peak performance. Okay. So, when we are talking about peak performance, I just want to know which nutrient is important for this peak performance. Those who are into fitness or sports, they can answer me. Protein, yes. Balance. Sir? Carbs, yes. We all, nowadays everyone is talking about protein. But today I will focus on carbs because for give your best. Carbohydrate is very important, and timing of carbohydrate, how much carbohydrate you have to consume is very important. Okay, so let's start. Slides, please. Okay, sure. Before that, let me know how many are into sports nutrition. Who practice sports nutrition? Okay, 2.
Who is the second one? Please raise your hand.
Miss Rupali is there, and we all know your dietitian only. Okay, in Odisha, actually, I must say, as a dietitian, we don't get so much of sports clients because most of the dietitians are working in hospital. Those who are also practice individually, this sports means like players don't come to us. I am fortunate client. If time permits, I will show you one of my case study. He is a badminton player who come to me. He was like 11 years old, and his coach he asked his father, you go to a nutritionist because you are a good player, but your performance is not as expected. And when I took the history, the main thing, diet is one thing. We know diet, but and his academy was taking good care of his diet. But the one thing which was lacking was the fluid intake. Okay, he was taking very minimum amount of fluid before, during, and during the match also. The only thing which, along with diet, which I specifically corrected was his fluid intake, which drastically changed his performance. If time permits, I definitely show his case study. It's done? No. Okay. Please. Phone that. Okay, my topic is what is fueling for performance. What is why we call it fueling. Fueling for performance is the act of eating specific foods during specific time windows to help maximize performance and support recovery in a certain activity. And why it is important? Because one size doesn't fit for every sports, okay? Different kind of sports are there. So for different sports, this diet is different, the timing of food is different, and it depends upon muscle fiber composition, metabolic rate, gut intolerance, and recovery capacity. And sweat rate, those means like many coaches are here, they must be knowing for every sports person we count sweat rate. As per sweat rate, their hydration, their electrolyte, all these things need to be fixed. And key features of peak performance are physical excellence, mental sharpness, technical mastery, tactical intelligence, and recovery and energy balance. To give your best, all these factors are very important. You should be physically, mentally fit. I have included things dietitian or coaches need to educate athletes to improve peak performance. I need my slide. Yeah. That's okay. Not happening.
Just 2 minutes, ma'am, sorry.
कौन है ला?
So ma'am, let's have some interaction instead of just standing. So sports nutrition, ma'am, as you know, like what is the is it necessary? I know someone who believes that after doing sport nutrition they need experience in a hospital instead in some with a sports academy or sports institution, in sports club. Is it really necessary to have this experience of 2 years to go to any club or football team or any club teams?
Yeah, to be a sports nutritionist, it's very important to work with the sports person in the ground. So to go to a club or any academy for sports nutritionist, it is very important, I must say. And second thing, theoretically you can't give any diet plan to a sports person. You have to see the person in the ground. Okay, many factors are there by which diet is decided. So you have to see the player in the ground to decide upon means what to give, how to recommend the diet plan.
Yeah, but hospital attachment, is it necessary?
For the sports nutritionist?
Sports nutritionist.
No, I I don't think hospital attachment is required. Yes, as a nutritionist in our basic course, we learn about physiology, biochemistry, all these things. That will definitely help you to plan the diet. But means like practically attached to a hospital, it's not necessary, in my opinion.
Yeah, that is what I want to say. Like when we're doing into sports nutrition, so what is most important is trying to understand yourself which sport. Because you are taking out of all the nutrition your chapters, you are taking that I want to be a sports nutrition. But sports is very vast. There's so many sports: outdoor sports, indoor sports, high contact sports, video game sports, lot of sports. So you need to be very focused in your mind that I want to go into this field. Say cricket, say athletics, say throwers, say football, all these type of fields. Expect that, then that's when your journey starts. So that is how you should go ahead, start with a smaller club to a very there is a bigger club, right?
And hospital nutrition and sports nutrition are two totally different fields, so that should not be mingled actually.
And ma'am, like suppose in high demand peak athletic person, like there are two types of sessions, like sometimes the sports person when he has to go for the race, the night before and the morning breakfast. Is it different, or do you ask to have a heavy diet at the night before? Or can you just tell the diet plan what we should plan for a sports person?
Yeah, actually, means like before the D-Day or sports day, during the sports and after the sports, diet recommendation is totally different, especially how much carbohydrate, how much protein they need to take. That is a total different calculation, which actually I want to show that. And I have also shown a diet plan based on that. Yes, a totally different diet plan is there. Before the D-Day, night time, what a sports person should take, and after, within half an hour or 1 hour, what they should take, that is totally different.
And which should be most, should we focus on protein? Because if we put more focus on the protein diet, we start getting all this hyperuricemia, all this pain on the gout and all. So, as doctor, like when patients comes to me, or sometimes they complain of knee pain, post-operative or sometimes like that, one of the cause is not this operative problem. It is the uric acid which causes the post-operative pain. They won't show you on the blood reports. You take the blood report, you'll see the uric acid levels are normal, but still the pain complaints. So post-operative diet, do you recommend to take nutrition? Because we need it for the proteins, for the muscle buildup, but how?
Yes, sir, we recommend, but as initially I said, nowadays everybody is focused on protein, but the main nutrient which we should focus on should be carbohydrate, not the protein. Yes, protein is very important to build the muscle and other things, but for peak performance, to perform in the field, carbohydrate are important, I must say. And as you said about protein,
Yes, ma'am.
as you said about protein, there is a misconception when uric acid is high. People usually restrict all kind of protein, which is actually not correct. Some foods are there which are purine rich actually. Okay, these foods are restricted in case if uric acid is high. That food we need to list down and ask the client to restrict all these things in their diet. Yeah, purine food, especially if I said vegetarian food, this cruciferous, cauliflower, broccoli, and in non-veg, chicken doesn't contain uric acid. This mutton, all red meat, sea fishes, seafood, all these contain high amount of purine in that. That should be restricted. And protein, yes, the amount of protein, whether you are prescribing 0.8, 1, 1.2 or 1.5, that need to be checked while prescribing the diet.
Madam, good afternoon. Myself P. Dharmarao, senior weightlifting coach and Biju Patnaik Award winner. Madam, I would like to know, just soon after prior to the competition, is it advisable to take baked potato instead of rice? Because if the sports person will intake too much rice, his or her stomach may be heavy feelings. So before lifting, it may hinder. So is it advisable to take baked potato, 1 or 2 baked potato instead of too much rice?
Yes, sir. Very good question. And yes, baked potatoes are means like we must. This is sports food. Easy to carry. First thing, it's easy to carry, and second. The amount of carbohydrate which means like baked potato, if I will ask you to take 2 baked potatoes, you will take that much quantity only. If you ask you take only 100 gram or 80 gram of rice, that may be differ. Okay, so baked potatoes are definitely post recovery or post any sports diet is a good thing to prescribe. Yes.
Ma'am, good afternoon, ma'am.
Good afternoon, sir.
I'm Ganesh. I'm a sports physiotherapist. I work with a high volume sports injury hospital setup.
Yes, sir.
Where we do a lot of surgeries for athletes. Now, when you said the nutrition for hospital and this should be different. We used to have athletes who come with an injury and get the surgery done, and then immediately we want them to be on a high protein diet. Now, the athlete is already coming with a carbs based and a protocol. Sometimes when I speak to I tell them, let me speak to the nutritionist. They have not much knowledge from the surgery point of view how we want to do a transition or how much protein loading and how long to be done. And as Dr. Sarthak said, sometimes the uric acid is more and we want the protein loading to be less.
Yes.
Now the duration, sometimes they are not knowing. So I think somewhere that transition, it is mandatory to know when you have a surgical intervention and then you are going into rehab,
field,
how long the protein loading has to be, and then you go on to accepting the loading. So that has to be based on the tissue healing. And then when the weight training is going to start, where we are looking at to build those. So anything on that would you like to add up to my point that the transition from the hospital nutrition to the performance?
Yes, sir. Means like very much agree with you. You are working in a different setup. Dr. Sarthak's question was those who want to pursue this sports nutrition, whether it is mandatory for them to work in a hospital or not. That I answered earlier. But as per your question, yes. The sports person who get injured and get admitted to a hospital, for them diet is totally different, which is a hospital-based diet. Post-surgery diet, I would say. And the time frame, yes, during hospitalization, we should take care of the protein part and recovery part after surgery. And when they are recovered and means like want to go to their field, then we will do the transition phase or transition diet we should recommend. Yeah, next. Okay. Next. Okay, here. Key determinants for individual fueling. First is training phase, off-season, pre-season, in-season, and competition. This is very important. The sports person going through which phase or in which category he is going on, that we need to check. Body composition goal. For dietitian, I must say when a client is coming to you, you must check his body composition analysis, fat percentage, muscle percentage, all these things. Then health status, gut issues, low iron, menstrual cycle in case of female sports person, and injury, environment like heat, which altitude he or she is going to perform, and humidity condition. As per all these factor dietitian has to do or prepare the diet plan for the sports person. Next. Yeah, nutrient timing is very important. Nutrient timing is a strategic approach as to how much, what and when to eat before, during and after training or competing to maximize effects of training. It's a system of working the composition of food selection, the portion and the timing of intake of food so that it must possibly can help improve the performance. Next. These are the benefits we all know. I will not go into details. Next. Okay, these are daily nutrient fueling strategies. Like optimized fueling leads to better endurance, power, reaction time and focus, which are very important to give your peak. Carb periodization, low, moderate, high carb based on training load. Protein timing 1.6 to 2.2 gram per kg body per day, evenly distributed. Healthy fat for hormones and recovery. Some people come to us and they say कि मैंने तेल खाना पूरा छोड़ दिया है. But oils are very important. We need to incorporate good amount of good quality of oil into like client's diet. Pre-training meals and post-training recovery meals are very important. As you see, pre-training meals, carbohydrate, moderate protein, low fat and fiber should be there, and post-training carbs plus protein. Within 1 hour, we need to give carbohydrate plus protein sources. Next. Daily nutrient requirement for peak performance, you can see carbohydrate 5 to 10 gram per kg per day, training load dependent. Sir was asking. Lower end 5 to 6 gram per kg, skill session, light training day, higher end 8 to 10 gram per kg body weight, endurance day, double training session, competition weeks, carbs restore glycogen and primary fueling. As per the session, as per the training, we need to increase or decrease the carbohydrate. Protein 1.6 to 2.2 gram per kg body weight, we know it required for muscle repair, recovery and hypertrophy. And protein should be spread across 4 to 5 meals in a day. Next. Fats 20 to 30% of total calories. Emphasize healthy fats, nuts, seeds, like good oils, all these things, and hydration 2 to minimum 2 to 3 liters per day. And as I said earlier, sweat rate to be calculated. Next. Okay. Today, as I have emphasized on carbohydrate, we will know about carbohydrate. Why carbohydrate before exercise is important? Spares use of muscle glycogen in endurance, stop and go and power sports. Runners lasted 12.8% longer with a pre-exercise carbohydrate beverage if given 1 gram per kg per body weight 15 minutes prior to the sports. 30 gram carbohydrate before and at half during a saucer match resulted in a 39% greater. These are the two studies I have quoted in which carbohydrate importance has been shown. Next. Okay, here you can see before 2 hours of your sports, up to 75 gram of carbohydrate should be given, in which 1 cup of sweet curd, 1 cup of fruit juice, 2 medium idlis, lemon water, 1 teaspoon of sugar can be added, 1 aloo paratha with light oil, 1 half cup of sweet lassi can be given, 1 cup of poha or 1 banana. This is pre-exercise, okay, pre-sports. 1 cup of upma, 1 200 ml of coconut water, 1 banana, 1 energy bar can be given. 1 hour up to 50 gram. These are the diet you can see: cornflakes, poha, chiuda, bread jam sandwich, banana, 1 cup of suji halwa, 1 cup of boiled sweet potato, banana, handful of raisins. These are the carbohydrate rich food which we can give to the clients. Next. Before 15 to 30 minutes up to 25 gram, these are the options you can see, and immediately before 15 gram. So you can calculate First is 75 gram, then 50 gram, then 25, then 15 gram. We have to calculate and give, and accordingly we can see the result. Next. Carbohydrate after exercise, recovery, refuels and restore used energy and adds in the repair of muscle tissue after training competition. We know all this. Next. Okay. When to consume, recovery snacks should be taken as soon as possible within 30 minutes after exercise. Here I want to say, nowadays people are focusing on giving protein within 30 minutes. There are also studies which show 30 minutes, within 30 minutes you have to give the protein, but for recovery carbohydrate is also important. So along with protein we need to give carbohydrate. Athletes should repeat the snack in 2 hours or consume similar carb quantity in the next meal. Carbs requirement based on body weight. Just click. No, previous slide. Click. Okay. Next. Next. Okay, post-exercise carbohydrate recovery Indian food option. I have given lots of, these are for dietitian. You can take like picture, what are the combination. There you cannot say ki this is not healthy, poha is not healthy, upma is not healthy. We cannot say that. We have to look after the how much carbohydrate that particular food is giving us. So these are the combination for particular amount of carbohydrate we need to give. Next. Next come the protein. Obviously protein is required for peak performance. Protein is the performance engine of the athlete's body. It supports every phase of training, strength, stamina, recovery and adaptation, making essential for achieving peak performance in any sports. The role we all know. Next. Next, please. Yes. This is the Indian protein food for peak performance. I have seen and divided into 2 slides. One is veg protein, one is non-veg protein, because we all know many of the persons are not taking non-veg. You can see moong dal, chana dal, rajma, chole, soya-bean, tofu, paneer, curd, milk, sprouts, quinoa, ragi. Obviously those who are taking whey protein, these are the good source of like plant protein or vegetarian protein which we can recommend to our clients. Next. These are the non-veg source. Chicken breast 32 gram, 100 grams gives this much. Fish, egg white, peanuts, almonds, all these things you can like provide to your clients. Again, here comes the like protein, how much protein is absorbed by the body, and we all know high biological value protein will be absorbed more by the body. So those who are vegetarian sources, in them we can like combine 2 vegetarian sources, like your khichdi, curd rice, all these things. Okay, so that the amino acid profile will be complete and it will be absorbed by the body completely. Next. Protein, yes, and how to incorporate protein is very important. Choose 20 to 30 gram of protein per meal. Instead of giving like all the protein sources in lunch or dinner, divide the protein sources into 3 or 4 meals in a day. Add protein in every snacks. Use whey or soya isolate post-workout. Combine dal and cereals to improve protein quality. Include fish and chickens 3-4 times per week for high performance. Next. Fats during running and training. Fat along with carbs are burned for fuel. Since fat remains in the stomach longer than any nutrient, it has the potential to impair performance if eaten too close to training or competing. Large amount of high fat food should be avoided for endurance athletes. Yes, fats are important. Good quality of fat need to be given in the diet plan. Next. Hydration is important. Even 2% dehydration reduces performance by 10 to 15%. And here I have given some points which dietitian or coaches need to educate their clients. Pre 5 to 7 ml per kg 2 to 4 hours before training, during 400 to 800 ml per hour depending on sweat rate. Sodium needs 300 to 600 mg per hour. Monitor urine color, weight change and cramps. Daily fluid targets to be set. Sweat rate estimation, electrolyte replacement like sodium, potassium and magnesium. Symptoms of dehydration versus overhydration need to be looked after, which is very important. We need to educate what is dehydration and what is overhydration. Next. Supplement, at morning we are discussing, our Iron Man sir has not taking any supplements, but yes, supplements are very important, and we need to check which kind of supplements they are taking. We need to check, whether it is approved or not. All these things we need to check. Next. Game day. 3-4 hours before, high carb plus low fiber plus moderate protein diet we need to give. 1 hour before, easy carbs like banana, energy bar, toast or honey we can give. During play, electrolyte drinks and small carbohydrate meals we can give to our client. And after game, carbohydrate plus protein within 30 to 60 minutes we need to give. Next. Okay, this is a very interesting thing. We called it as train the gut. Who all have heard about this word, train the gut? What is train the gut? Like simply, you are used to, or sports person are used to take certain type of food. If that food has been changed on the D-Day or sports day, the person will not give his best. Okay, he may suffer from some stomach issues or some kind of health issues. So whatever you want to give them for their best performance, you have to practice that long before. That is called train the gut. Okay, next. Okay, in case of female athlete, we need to take care of certain things like menstrual cycle awareness, prevent iron deficiency, ferritin test is mandatory for them, bone health, avoid carbs, protein, energy availability, do not train fasted frequently, hydration and electrolyte need to be taken care in case of female athletes. Next. Okay, this is a case study which I was talking about. It's not that, but a simple one. Mr. X is a 20 years old tennis player. His coach is very concerned about his health and performance as his hitting accuracy is poor and he is also not able to balance well after hitting a shot. So these are his details, like height is 175, weight 54 kg. And training, tennis training 3 to 5 p.m. and food preference non-vegetarian, food intolerance, he was lactose intolerance. Here anthropometric measures are missing, and as those who are into sports nutrition, they must be knowing for every sports there is a height, weight things, okay? To play certain sports, you need to so much of height and so much of weight. Every person cannot play everything. Some person are obviously exception. Okay, this is his dietary recall. Before coming to us, he was taking, before going to, he was a college student, 1 cup of oat milk with Bonvita, lunch chapati 3, dal tadka, cabbage with chana dal sabji. Before training 1 banana, during training only water, post training 1 energy bar, and dinner rice, curry, beans, vegetable. Is this sufficient for this person? Can you think he can give his best? Okay, next. Okay, I have calculated his calorie, protein, carbohydrate as per this energy. I have given his weight was 55 kg, 54 kg, so 55 kilocalorie, which is 2,970 kilocalorie. I have recommended 7 to 8 gram per kg. Specific preparation phase like 399 carbohydrates, grams of carbohydrate recommendation was there. Protein 1.3 to 1.6 gram, which comes around 91 grams, and 20 to 30% of total calorie, which comes 100 grams of fat around. Next. Yeah, this is the recommended meal plan I have given. You can see I have modified his current diet plan into a better one. You can see. And next, next slide please. Yes. Here is the detail. You can see calorie, protein, carbohydrate, fiber, everything I have given. And this total menu plan gives 2998 calories, 115 gram of protein because that varies day wise. And fat comes around 91 gram and carbohydrate around 451 grams. Next. Nutrition supplement, obviously as for sports we need to decide the supplements. Next. Yeah, these are the dietary lifestyle guidelines I have given. Increase the number of meals based on training. Take care of pre and post training meals. To increase energy level, post training recovery, add starchy foods like boiled potato, sir was asking, sweet potato and boiled corn. Do not drink water before meal, but water 250 to 300 ml should be taken before training and during every change over shift. Take 200 ml of water or like bouts from sports drink. Deworming is needed. Starting the diet regime, take care of 6 to 8 hours of sleep. That's all. What we eat, when we eat, and how much we eat affects how we feel, how we recover, and how we perform. Thank you for your patient listening.
Do anyone have a question, especially the dietitians or a physiotherapist? No, so I have a question, ma'am, for you. Thank you for enlightening us. But we are running every day millets. We are going on. So I had an experience. I have an institution where October there was the sports, and they asked me that they have got an instruction to give 30 or 40 gram of millets in every meal. And it took few days to make them understand it is not a protocol, because millets again have a phytic acid. So as a sport nutrition, what is your message that how much of grams in a day a millet can be utilized for a sports person?
Very relevant question, ma'am. As after this millet mission, everybody is after these millets. So millets are actually very good. They are rich in fiber, rich in protein, rich in many micronutrients. Yes, we can incorporate these millets into sports person diet plan, but the rule is basically millets are cereals. Okay, we cannot consider them as protein source or other sources. As cereal sources that gives carbohydrate, so millet should be 1/3, means the carbohydrate which comes from millet should be 1/3 of total carbohydrate. If you give like 300 grams of carbohydrate to a person, 1/3 matlab 100 grams of carbohydrate should come from millets. Accordingly, you can plan the diet menu.
Thank you so much, ma'am. Do we have any other question from the audience side?
No, we have to, because time is up.
Okay, thank you so much, ma'am, for beautifully explaining us about the topic sports nutrition, and I'm sure it would be useful for all of the persons present over here.
Thank you, Dr.
once again.
Sarthak, for the opportunity. Thank you so much.
Now I would like to call upon the forum our next speaker, Dr. Renu Vijay Londe. Dr. Renu is a well-known physiotherapist currently associated with Dinanath Mangeshkar Hospital and Research Center. She has an experience of over 16 years in physiotherapy and has contributed to handling numerous complex cases in several hospitals. We warmly welcome you, ma'am.
Thank you so much. Good afternoon, everyone. So my today's topic is role of GERD in throwers. Before starting my talk, I would like to know, in your day-to-day practice, how many of you all have heard that a player complains that whenever I try to throw, the velocity of the throw is less. That's the only problem I have. Or I have pain, especially when I take my hand into abduction and external rotation, especially on the posterior aspect. Rest everything is going good. Or the one thing you will observe is on the dominant side, their internal rotation is less compared to the non-dominant side. Then that's what we are going to talk today. What is wrong with that particular player's shoulder? Why is it happening? And how to treat it. So, coming to our next slide. These are the phases of throwing. The shoulder is at most risk during the acceleration and deceleration phase. So, whenever a player is throwing a ball, where is the energy coming from? Is it coming from the shoulder? Absolutely not. It is coming from the ground, exactly. So what the Newton's second law states, for every action there is an equal and opposite reaction. Good, glad to hear everybody's awake. So whenever you land a foot on the ground, that's the action which you are doing, and the reaction is coming from the ground. That's the ground reaction force, which comes from the ankle, knee, hip, torso, shoulder, and then it is released to the ball, right? So here, what is the shoulder doing? It is just acting as a link between the, what is it called? Kinetic chain, perfect, very nice. So it's just one of the link in the entire kinetic chain. What it is doing is just transferring the energy which is coming from the bottom to the distals. So the most important thing here we have learned is the kinetic chain is very important. Even one link of this chain is weak, it is going to affect the entire thing. So the energy 100% is going to get transferred. Each and every link is strong enough. So what is going to happen at the shoulder, we'll come to it. Before that, I'll just slightly go through the force couple. So this is the force couple, as we all know. Can you just pause for a while? So this is the first force couple between the serratus anterior and lower trapezius. So whatever muscles we are going to learn right now, these are the at most important shoulder muscles. A player cannot afford to not to strengthen or ignore these muscles, all right? So first force couple is the serratus and trapezius. Yes, please play. So what it is doing is it is beautifully stabilizing the scapula so that your humeral head can rotate on the glenoid very well. All right? Then the second is your supra and the deltoid. So here, just imagine if the serratus and trapezius were not working very well. So here we have understood why the scapula needs to be stable so that the rotator cuff muscles, which is sitting on the scapula, can work efficiently. All right, so the number one was serratus anterior, lower trapezius force couple, second was supra and deltoid. And could you please pause for a while? So here, the deltoid is not important at all because what it does, it pulls the humeral head superiorly. In fact, what is going to happen? Impingement might happen, right? So what the supra is doing, it is keeping the humeral head centralized. So here, you don't have to focus on the deltoid. The important muscle is your supraspinatus. So coming to our next one is the anterior and posterior force couples. Let it be. Yeah, let it be. So number one was serratus and lower trapezius. Here, the deltoid, you don't have to focus on the deltoid as much, you have to focus on the supraspinatus. So beautifully stabilizing the scapula by the serratus and lower trapezius, and now keeping the humeral head by your supraspinatus. Then the next force couple is our anterior and posterior. That is the subscapularis in the front, and at the back it is the infraspinatus and teres minor. So all these force couples, they keep the humeral head centralized so that there will be an optimal range of movement. So what I talked up till now was the muscles which a sports player cannot afford. Dole shole nahi banaya to bhi chalega. Deltoid, biceps, triceps and upper trapezius, they are just going to do the movement thing. Are they going to stabilize the shoulder? No. What is going to happen if these muscles are weak? Dislocations, dyskinesia, right? So we have understood now the important shoulder muscles. We'll come to the next slide. Oh yeah, so today's topic is GERD. What is GERD? GERD is nothing but internal rotation deficit. How do we measure? Patient lying in supine position with with the goniometer, we are checking the external rotation, and then we are going to check the internal rotation. Coming to the next slide. So here, what we are doing is, we are checking the range of movement. Normally, the range of movement should be 180 degrees. So, if you see on the left side, hand side, the external rotation and internal rotation, the entire arc is 180 degree. Till the time the arc is 180, that's absolutely fine. Now, what happens in the sports player? They try to increase the external rotation. Why do they try to increase? More the external rotation, more the velocity. Very nice, good. So, there is a gain in external rotation. If you see on the right hand side, there is a gain in external rotation, but there is a loss in internal rotation, right? So if a player is increasing the range by 30 degrees, but the internal rotation is also decreasing by 30 degrees, that's absolutely fine because the arc is maintained. Coming to our next slide, the problem. When is the problem? The amount of range you have gained, in the same amount, you have not loosened the range of movement of the internal rotation. If the internal rotation deficit is more and arc is not reaching up to 180 degrees, then that's a problem. So when we call it as a GERD, that is when the internal rotation deficit is more than 20 degrees. Along with that, if your arc is also not 180 degree, then the player is having a pathological GERD. So, coming to our next. Why does it happen? Why this is happening? External rotation is increasing, but the internal rotation is so much less because of your tightness in the posterior capsule. Now, why does it happen? So, during the deceleration, when the ball has been thrown, there is a tensile force acting on the posterior inferior capsule. Now, the posterior cuff muscles, they provide a compressive force to resist this tensile force. But no doubt that your capsule is subjective to this repetitive high load leading into hypertrophy of that posterior capsule. So as we all know, now the inferior capsule which is exactly beneath our humeral head, it acts like a hammock and our humeral head is beautifully sitting in that hammock. So when the hand is taken into abduction and external rotation, if you see the B thing, what is happening? The inferior capsule, when the hand is taken in abduction and external rotation, it is coming here. When the hand is going into internal rotation, it is going to go behind, right? So, what is happening is the PIGHL, that is posterior inferior glenohumeral ligament. So now that band becomes tight, and because that band has become tight, what is happening is the center of rotation is now shifted posterior superiorly, and because of that the band now which has become tight, it is coming here, it is pushing the humeral head posterior superiorly. What happens because of that is, if you see, the center of rotation is normal in the seat, in the first image, the cuff muscle is getting impinged. Since the center of rotation has shifted posterior superiorly, now the greater tubercle can clear the rim and an additional external rotation is achieved without any impingement. But this additional external rotation minimizes the cam effect of the proximal humerus on the anterior inferior capsule. And this additional external rotation is happening because of the redundancy in the capsule. What happens to the biceps at the same time is, the biceps now assumes a more vertical and posterior position. Because of that, it gets twisted at the base of the tendon. And because of that, what happens is, it transmits the torsional force to the posterior superior labrum. And if you have heard about the slap, that is what happens to the players. Because of this repetitive higher load, they land up into slap tear, that is superior labrum anterior to posterior. And also because of this hyper external rotation, there is a hyper twisting of the cuff muscles which leads to tear. So pathological cascade, if you see, just a simple tightness in the posterior capsule of a player, just because they are not stretching it after their sessions or practice, these are all the pathological cascades they can go through, what we learned right now. So the most important thing we have learned today, a thrower, you have to make sure is having a good posterior capsule flexibility. All right? Coming to our next is, as a physio, what is important is, number one, normalization of the GERD. So how we can do it? tightness, we have to release it with the stretches of our posterior capsule stretches. Increasing the strength, scapula, rotator cuff. We have seen the slide of the 4 scapula. No doubt we have to focus on those. Core, why core? Because of the kinetic chain. And then proximal stability for distal mobility, proprioceptive plyometries. All these exercises later on you have to add to the player. So this is Pune Shoulder Rehab Program designed by an orthopedic surgeon. He's a shoulder and sports surgeon in Pune, Maharashtra, Dr. Ashish Babulkar, and he has designed this program, and there are n number of players who have got benefited out of this program. I've just listed a couple of them. It is Ravi Kumar Katulu. He's basically from Orissa itself. He is a weightlifter. He had underwent into slap tear and a cuff tear, and post-operative he has won the medal. He has got silver in Glasgow, and he had played in Olympics also post-operative, mind you. And this is Disha Patil from Maharashtra, and she has been operated for slap and bankart, and after that she's a boxer, and she has also received a number of medals. But the thing is, and the point is, that the players basically can go back to normal to their sports, even though they have land up with slap tears or cuff tears. And this is an app which has been designed by Dr. Babulkar itself, and whatever exercises we give to those patients, and this is a beautiful app for the same. Yeah, so this was all about the GERD. Thank you so much, and I would like to take up any questions. Sorry. Yeah, can you just get the app slide? Yeah.
So do we have any questions from the audience side?
Yeah.
Okay, thank you.
Thank
Thank
you.
you so much, ma'am, for such a wonderful session. I'm sure most of the sports professionals must have gotten their major takeaway from the session. Thank you. Now I would like to invite Dr. Gayatri Upasana Acharya ma'am on stage. She holds a specialization in musculoskeletal sports. She has been an associate professor in Absmari, India, having an experience of over 8 years. We're glad to have you, ma'am.
Thank you. A very good afternoon, everyone. So my topic is on on-field injury assessment and the practice session. Every second count when a player is down. As the athlete push their limits, the demand for immediate, accurate care grows. So there are some effective strategies. There are some strategies for again, I'm telling. A very good afternoon, everyone. So my topic is on on-field injury assessment and the practice session. As the athlete push their limits, the demand for immediate, accurate care grows. So there are some swift, effective strategies starting from stop approach to navigating complex game day scenarios. Whether you are a seasoned therapist or a frontline sports care provider, it's important to safeguard the athlete when it matters the most. So now practice session is the very important in making the overall athletic excellence. Now coming on to the practice session for resilience, for peak performance, and now coming on to what's the purpose of practice session now? It's for skill acquisition and for conditioning. So now coming on to the skill acquisition is the process of perceptual, cognitive, and skills, motor skills, which is again needed for a overall athletic performance. So now and the abilities to develop effective instructions as well as constructive structured practice, which is again a combination of both physiological and psychological factors, which is again needed for a specific sport. So now coming on to the conditioning. Conditioning is very important in training the overall designing of making the athletic performance proper. So now what are the training sessions? So now coming on to the training sessions, there are various training sessions like endurance, strength training, and agility training, and flexibility training, which is again important to improvise the neuromuscular system and improve the firing patterns, which is again important for slow twitch and fast twitch muscle fibers, right? So again, it optimizes the overall athletic performance and reducing the risk of injury. So now coming on to, now the question is how to assess an injury of an athlete, right? So we need to assess injuries in order for us to look type of treatment, right? So whether there is as we already know about the treatment for both soft tissue and hard tissue, but when there is an injury in case of a sporting field or in a training session, it's important to focus on various approaches, right? So now coming on to the various approaches, first is primary approach, primary assessment, and secondary assessment. So now coming on to the primary assessment, here evaluation is done, right? Evaluation is done with the patient or athlete to ensure that life-threatening situations can be handled immediately, right? Here the primary survey takes, right, 30 seconds to 2 minutes with a maximum onset of 10 minutes, right? Here we need to assess with little or no movement, okay? And if required, emergency services need to be called immediately, right? So next is secondary assessment, which is again important to assess injury. Here, evaluation is again done on patient or athlete, right, to ensure that whether patient is conscious or not, right, and they're not under any immediate threat. Okay, and here we need to check head to toe physical examination. Head to toe physical examination is done to detect any sort of injuries. And whether there is any serious complications or not, we need to see the overall thing, and then immediately, if there is no injuries or nothing, then the therapist can go back to check the assessment. So now coming on to there is a procedure, right? So coming on to the detailed assessment, primary assessment. So there is a procedure known as DRABC procedure. DRABC procedure, right? So this DRAB procedure is also known as the primary survey, which helps to establish the level of first aid needed to be administered, whether there is a need to call for the emergency services or not, right? So now first one is coming on to D, which is the primary survey, right? So this is the primary survey, danger. Here we need to assess the environment, right? Assess the environment. Here, whether there is the athlete and the patient, right? Athlete, patient, as well as the therapist. We all should assess the environment. Accordingly, we need to proceed. Danger means what? Can anyone say what is danger? Assessing the environment, correct? Whether the injured player is in the safer place or not. If not at all, if they are not in the safer place, then immediately we need to get back to the remove the player from the site, right? And next is coming on to response, R. R is known as response. It is important to check whether the athlete is responding or not, right? So there is a scale used to assess the response that is known as AVPU scale. First is known as the alertness, right? Next is voice, then P, okay, then unresponsiveness. So now coming on to alertness, previously. Alert here indicates whether the player is moving or not. We need to check whether the player is not. If the player is not moving, then we need to proceed it to V, right? So voice. So here we need to check, here we need to speak clearly and loudly with the player. If the player is not responding, then immediately we need to go to P, right? So pain. Here we need to place our hand on the collarbone and carefully but firmly shake the patient. Continue. Here we need to speak to the patient continuously, right? If at all there is no sign, if the player is not responding, then we again need to go back to unresponsive, right? So at this point, the player is assumed to be unresponsive. There is no response from the player. So now coming to A, that is known as airways, which is again, if the player is not responding, then we need to go to airways, right? So airways is very, very important here. Airway assessment is very, very important to check whether the player is having any sort of airway obstruction. Okay, so in sporting injury, we see there is a procedure known as Helmich procedure, right? So this we need to check and clear the airway. The next is breathing. Breathing is again very, very important to check in case of an injured player. Normal breathing, right? What are the normal breathing? We need to see whether the chest expansion is happening or not. We need to see, there is the normal, we need to check through the hand and see the cheek, right? So these are the things, breathing, we need to check. Next is coming on to your circulation, right? Circulation again is very, very important to be seen. So these are known as the DRABC procedure. So now next. So now after primary assessment, next is known as secondary assessment. So as I told you, in case of secondary assessment, here we need to check the extent of injury, right? We need to check the extent of injury where here evaluation is done with the patient or athlete to ensure that there is no patient is conscious and is not under immediate threat and is able to respond by talking and shows no stress in terms of circulation or breathing. Okay, so this is what we need to see in case of secondary assessment. Okay, so here we next to DRABC procedure, there is known as toe taps. Toe taps, this is coming under the secondary assessment. So what about this T? T is for talk. Let the player guide you. Right? Then next is ask the player. Ask the player the question to understand the injury from the perspective. What exactly has happened? What exactly has happened and where it hurts? Where exactly there is pain or where does it hurt? Right? Next. O is to observe a thorough visual inspection. We need to observe it, right? So visually examine the injured area and player as a whole. Look, we need to check for any sort of deformities or swelling here. We need to check for any deformities or swelling here. So now comparing, we need to compare. If there is any swelling or deformities, we need to compare between two sides, right? So this is all about O. Then next is T, that is known as touch. A careful hands-on evaluation is important here. So here we need to, with care, we need to palpate the area to gather more detailed information. So we need to check for any sort of tenderness here. So tenderness, temperature, pain, so all sort of things we need to check here. So next is movement, right? So there are two things, toe taps. There is active movement and passive movement. So now coming on to the active movement, we need to ask the player, right? And check. We need to ask the player to move the injured side without any help. Till the pain we will see, then we'll leave it. The next is passive movement. If the player can move the injured part through active range carefully, then we need to try to move the injured part through its full range of motion only to the point of pain. Okay, so this is all about the active movement and passive movement. So now next. So this is the complete protocol, a framework for confident action. So first is injury occur. Again, I'm just giving a brush up, last 2-3 minutes. Injury is occurring. There is a primary assessment. We need to go to DRABC procedure, danger, response, airways, breathing, and circulation. Then next, if there is any threat to the life, right? Yes, we need to call for the emergency services. If no, then we can go to secondary assessment, right? So that is known as toe taps. Here we need to check the extent of injury. In case of secondary assessment, we need to check the extent of injury. Okay. This is then directly we need to, if there is no such emergency, if there is no such injury, then we can directly return to sport. Okay. So this is all about the assessment. Right? Again, just give me 5 minutes. I am again going to summarize this to you. Just I need another 5 minutes. Can I get another 5 minutes? Sir, can I get another 5 minutes? 2 minutes, 3 minutes, 3 minutes. Okay, so again I am telling the topic is about what? The topic is about on-field injury assessment and the practice session. Right? Yes? So what was about the first, this thing? Every second count when a player is down. Correct? Yes? So yes. So again I'm telling, as the athlete push their limits, the demand for immediate accurate care grows. So there are some swift strategies, there are some effective strategies to prevent injury, right? So this is all. So again I'm telling, right? As the athlete push their limits, the demand for immediate accurate care grows. So there are some swift, effective injury evaluation strategies, starting from stop approach to navigating complex game day scenarios. Whether you are a seasoned therapist or a frontline sports care provider, it's important to safeguard the athlete when it matters the most. Now, coming on to practice session, right? So practice session is the backbone of overall athletic excellence, shaping skills, resilience, and peak performance, right? So now what's the purpose of practice session? Okay, so now coming on to the practice session, it is for skill acquisition and conditioning, correct? So coming on to the skill acquisition, it's the process of perceptual, cognitive, motor skill, correct, which is needed for an overall athletic performance, and the ability, and to develop abilities which is required for effective instruction and structured practice with physiological and psychological parameters or characteristic, which is again important for a specific sport, correct? So now coming on to conditioning. Right, so conditioning is a training design which is important to enhance the overall athletic performance. So that it involves various sort of training here. So first is flexibility, agility, then speed training, endurance training, so all sort of training, right? So it, what happens here? It improves. What it is improving? It is improving the overall neuromuscular system. Correct, which again has an impact on firing patterns on both fast twitch and slow twitch fibers. So now what are the fast twitch fibers? Can anyone? Fast twitch fibers. Can anyone tell what are the fast twitch fibers? Fast twitch fibers. It's sprinter or marathon runners. Huh? Why? Huh? Can anyone? Okay, so there are two fibers, right? So there is fast twitch and slow twitch fibers, which is important to optimize the overall athletic performance, correct? And reduce the risk of injury. Huh? Okay, so now the question is how to assess an injury of an athlete. We need to assess injury in order for us to work out which type of treatment is needed. So as we already know about the treatment for both hard tissue and soft tissue. Now coming on to if there is an injury in case of a sporting field, or in a training session, it's important
Madam,
to
your time
approaches.
Excuse
right?
me, madam, your time is already over. We had given you 2 minutes already. Dr.
Okay.
Sarthak has given.
Okay.
Again, you are asking question and answer. It's a paper presentation.
Okay,
Please
okay.
bind up within
Okay.
seconds.
So any questions? Any questions? Any questions? So any doubt in primary or secondary assessment? So in primary assessment, we need to immediately check right? So that's 30 seconds to 2 minutes, then 10 minutes. Okay, here there is no movement, little or no movement is there. If needed, we need to go for the assessment. Next is secondary. Primary assessment, we are going for DRABC procedure, danger, response, and breathing and circulation. Right? So danger is the primary element. Here we need to check whether the injured is hazardous or dangerous. If not hazardous, dangerous, then the responder or the therapist can go for the assessment. Correct? Then next is airways. Then response. Response is done. Response, it's a level, right? So there is alertness, use skill. Alertness, voice, pain, and unresponsiveness. Alertness, what do you mean by alertness? We need to check whether the player is alert or not. If not alert, then immediately we need to go to the, proceed to the V, right? We need to speak clearly with the athlete. Then check whether the player is responding or not. Then we need to go to the P, that is known as pain. We need to place our hand in the collarbone and need to shake and check whether the player is responding or not. And the therapist should be within the eyesight of the player. Then we need to go to what? If they are not responding, then we are going to use unresponsive, right? Any question, any questions you can.
Clarification that okay, you can discuss. Now the next presenter.
Okay, thank you. Our guest has also to go, so we have to do the first station. So Bala, please, you just come.
I would now like to request Dr. Bala Kishore sir to kindly come up onto the stage. Dr. Bala is the head of Department of Physiotherapy Department, Some Ultimate Medicare, with over 15 years of experience. Over to you, sir.
Very good afternoon all. My topic is neuromuscular training and return back to sports. It's a very good topic. A training approach which will helpful for enhancing the communication between your nervous system and the muscle. That is the main important thing after injury a player should do. Before that, there is why it is important, we have to know that. It is an important for the coordination, balance, agility and the power training. The athlete should return back to sports after sports injury. It is very much important to have a coordination between the muscle and the nervous system. What is neuroplasticity? Neuroplasticity in the sports. Have you ever listened the term neuroplasticity in sports? Yes or no? We have learned in neurology only, I think, but we have to utilize this in the sports. It is helpful for the adaptation of new techniques by the professionals, by the professional players, coaches and the sports therapist, strength and conditioner trainer, which helps to teach and the new skills for athlete to return back to the sports, which helps in the new techniques. How it will helpful them? By using the neurological technique only. The nerves and the muscle fiber, we have to activate them, the nervous system and the muscle should be coordinated way they have to work it. It's a pattern of working the skills which helpful for the neuroplasticity to remodulate the brain system. Next. Have you ever listened the term muscle memory? Muscle memory, it is very much important for all the athletes. Post-injury, what happens? There will be an decrease in the strengthening area. The muscle will have the pain. The athlete should not have to go for the training sessions. Then the muscle memory is very much important to recall the training session, how they perform. At this time, the psychologist, sports psychologist role is very much important to help them to counsel, to fear out from the anxiety level. The muscle memory will helpful for the movements, quick and without any extra time of consciousness, which is helpful for the return back to the sports. Is muscle memory helps by the coordination of the therapist, the trainer and the player. All the three should have to work at a time to perform the muscle memory to regain the strengthening protocols. The goals of neuromuscular training. First is injury prevention. How it will prevent? We have to strengthen the muscle and to stabilize the joints, which helpful for the balancing. Next is performance enhancement. Performance enhancement. How it will help? By increasing the speed, power agility, and the athletic performance. The rehabilitation support, what we will give by a therapist, the coach, and the strength and conditioner, the master, and the diet and nutritionist, also the sports psychologist. They all the team members only helpful for a performance, the rehabilitation support team. Without them, the recovery of the athlete will not be there. Next. The neuromuscular training techniques, what we are using that. The proprioceptors, which are very much helpful for the spiritual orientation, which is very much important in post-rehab, post-ACL injury or any kind of injury, proprioceptor training is very much important. Then the functional movement pattern, then sport-specific drills. If functional movement pattern means, if a player comes with you, we will train him in a closed environment, like in a gym or in any setup of the closed environment. But functional drills should be done in an open environment, they will helpful for the open environment for the performance of the athlete. That is the sport specific drills. If a person athlete came to us, within the two athletes, we take it them. One is marathon runner, one is sprint. If I will train them for a marathon run for the sprinting, it is difficult for them, and the muscle will not activate for them. That is the sports specific games we have to train them. Next. The performance trainer, all the team members, you should name MD, diagnosis, game planner, psychologist. The team members I have told. Then the decrease the pain function, the physiotherapist role, compensatory pattern, joint function, the performance specialist, the strength, the movement skills, metabolism, recovery, nutrition, and psychologist. The technical terms and the psychologist. So it is a team approach that group of therapists, group of doctors, group of nutritionists should have to work to perform the result of the athlete. Next. This is an example of them. You should have to treat a athlete, not and diagnostic scans. What I said, did you understand? Treat the athlete condition, not depends upon the scans. The what is the MRI and the X-ray reports is not the physical diagnosis. We have to do the physical diagnosis. We have to assess the total. A person, for example, if a patient having a low back pain, okay, repeated low back pain, and he is having a flat foot. But the athlete comes to us, sir, I am having a low back pain. Repeatedly, they are doing the strengthening session. After few days, the same complaint he come to us, sir, I am having a back pain again and again. But we have to think about the total system. We have to not only the back pain, it is not due to only lower back muscle or the core muscle. We have to do the assessment of the foot. That is very much important. If a flat foot is there, then the athlete may also having a postural alignment changes. The kinetic chain was disturbed. So they may have a back pain. Repeated small injuries may lead to big injury. Next. The neurokinetics in the sports, it is based on the premise of injury occur, certain muscles will get certain down. Okay. If the injury in my shoulder joint, then the shoulder joint muscles are ready to get down and take rest to recovery. Then some muscles will be overworked to compensate the movement. If an athlete performing in a national level, he was telling that, sir, my next match is there in a gold medal or the silver medal. At that time, they having a shoulder pain, he used to take a painkiller. Then he performed the event. After that, the injury may increase. So we have to take care of the total biomechanics, the neurokinetics, how he is lifting, the slow motion, the video analysis we have to do, the biomechanics, where it is the faulty techniques they are using. Though not only in the weightlifters, they are also having a javelin throw. Next. This is an example. The patient come to us with a low back pain and the javelin throw. This is the normal, first picture is the normal alignment of the posture. The second one, he is having a back pain, use the low waist LS belt, and the total technique has been changed. The total throw of the athlete has been totally changed. Though technique was changed, the athlete performance also decreased. Next. So the key components of neuromuscular training is, first is balance training. Balance is very much important. Okay. Next is strength training, plyometrics, and the agility drills. Balance training, what are the things we used to do? The balance board activities or the Swiss ball activities or single leg balancing trainings. But nowadays there is an water bag technique. Have you seen? water bag technique. There is an stability balance will be helpful for them. Then next is the strength training, the resistance training, the targeted group of muscle. Always you have to do the core muscles training of the each and every athlete. The core is very much important to maintain your posture. Then the plyometric jumping activities which is helpful for the power generation. Then agility drills for our quick reference of the foot and the assessment. This is a Swiss ball training for the functional stability and the activities. Next. This is the variation of the Swiss ball training. For this, I request the Ansman, please bring the water bottle. Functional training, I want to give one example. In neuromuscular training techniques, he is having a shoulder pain. I have to activate them, but in only one session, we have to activate both his lower limb, trunk, and eye-hand coordination. Okay, just bottle give me. ये bottle को पकड़ना है, jump करना, पकड़ना, ठीक है? Hold it. Abduction, ये hip abduction, extension, abduction, extension, ठीक है? This is the only one activity I am planning to strengthen his lower limb, the glute muscles. Okay, keep it. ऐसे रखना, ठीक है? Extension करो. His lower limb activation of the hip muscle, back extensors, and your shoulder abductors. Along with that, I told him to do the ball catching of the water bottle. This is helpful for the eye-hand coordination, neuromuscular training it is. The total limb has been balanced in the right lower limb. I had activated his back of the hip extensor muscles. I activated his shoulder muscle to recruit the motor neurons, more number of motor neurons in a single activity. Okay, 10 to 15 repetitions and try करो. Then add the variations. The movement, yes, hold it, इसको इस position में. Yeah, अभी करो. ठीक है. It will helpful for the activation of the reaction time also. Only a single activity, but it is helpful for reaction time, strengthening of the upper back, strengthening of the lower back, and the core muscles in single activity. It seems to be a strengthening protocol, but it's called as neuromuscular training with coordination. Next. Thank you. We use this magnifying 7 protocols. First is range of motion, second is wall angle position, third is overhead squats, fourth is single leg balance, and the single leg squats, single leg bridges, seventh is respiration. The total score is 21. Along with that, we have to do both the sides. Okay. Next. The loading and the repetition will increase the reciprocal. The graph shows that how much load you have, how much repetition you are giving, and the injury what it is. The external demand kitna hai, or deconditioning functional capacity. It will helpful for the injury. If your load is more, the muscle is not adequate enough to take the load, then the injury chances is more. Then the load is low, the performance also hamper. This is the word exercise, nutrition, and the rest. These 3 coordination is very much important for the athlete to have it. What exercise they are doing. If a person is having a marathon runner, what type of exercise they are doing. If a person is in sprint, what type of exercises. And what type of nutrition we are giving. If an athlete is taking dehydration or hydration protocols, protein more, carbs more, and the rest, how much rest they are taking mentally and physically. All 3 coordination is very much important for the performance of the athlete, which hampers for the athlete performance also. This is the foundation movement retraining. What kind of foundation movement? To lower limbs. Lower limb is very much important, all the sports. Then the high sports. इसमें रखना. Then the high sports type retraining. Then third one is sport specific training. Next. For example, एक football player है.
Mr. Balakrishnan, you have to conclude within 2 minutes, please. Time is.
For example, this is a sports player who is used to football player. So when he try to kick it out in a drills, whatever we are strengthening in a closed environment, they have to perform it in the open environment. At that time, we are not following this. If someone will they dash, someone will there is a contact injury. There may be a chance of injury of the lower limb, ankle or the knee joint will be there. But for that, we have to train them in a closed environment also. Next. Skill rated components. What are the skills? The power, speed, agility, balance, coordination, and reaction. What example I had told. Next. इसके बाद आ जाना. Return back to sports लेके आ. नेक्स्ट फॉरवर्ड करो फॉरवर्ड हाँ रिटर्न बैक टू स्पोर्ट्स इट्स अ बिग क्वेश्चन व्हेन आई गो बैक टू स्पोर्ट्स after his injury always every player having a doubt that can I play, can I perform well, what is the performance I will have. They have lot of stress in their, not in the physically, they are also having a mentally also. The main performance before return back to sports, we have to do a pre-participation evaluation also, which helps for the elements of the composition of the sports and athlete specific components we have to do. इसको आगे कर देना. Back. In this we have to categorize in 3 states: health risk, activity risk and tolerance risk. Health risk and the activity risk, I want to describe it: type of sports and the position of a player. If a player is having a type of sports, mean football, for example football, he is an defender or he is a striker player, then we have to train them in accordingly. The rehabilitation phase, return to sports and return to competition.
Concluding page. Okay.
Last page.
Come to concluding page.
Last page. Drugs and the athlete. As Sir told, more athletes are having after injury. Someone help them. They please take this medication to recovery back. Someone tell ये medicine खा लो, ये protein खा लो, recovery जल्दी होगा. But the athlete, the therapist, the coaches, everybody should have that much of knowledge regarding the doping. Okay, or else the player may have the dope test positive. The return back to sports. Please. Return back to sports, we have divided into 5 stages. One is no activity, then light aerobics, sports specific exercises, then non-contact training, then full contact practice, which I told it, full contact practice in closed environment. Go for an open environment, which is helpful for the recovery and the performance of the player. Thank you.
Thank you very much.
We will go for the first session ceremony, sir. Dr. Ganeshan, I hope you understand. Thank you very much. We have discussed. So because our guests have to leave and few of the respected faculties have to catch the flights. So we start the first session ceremony, and I would like to invite Shri Prabodh Mohanty ji on the stage. Welcome. So he's the director of the SN Mohanty Group and also the co-sponsor for this SSI Sports Science Award and the Sports Science Conclave. He's been phenomenal in helping us, do completely from a different background and always stood with us like a backbone and a brother like for me, or I can say my brother. And it's thanks to him that we have been coming up with the 3rd edition again, positively. Please. Then I'd like to call upon Group Captain Dinesh Suri sir. He's the CEO of Odisha Athletics, Kalinga Stadium, and also the state. And he's an ex-Air Force officer. I feel proud because I've been coming from the Army background. I'm someone very close, first and close to an Air Force officer. Then I'd like to call upon Mr. Swami Patnaik, the founder of Sports Science India, and my elder brother for him standing in front of you because he has got meeting date. And thank you very much. So we will start the felicitation ceremony. To start with, we will first go to call our first speaker of the day, Ms. Pushpanjali, for her speech on the yoga. She was very nice to say yes to us from a busy schedule. Ma'am, please come on the stage, please.
ఎప్పుడు జాను సుభద్ర ఎప్పుడు జాను ତାଙ୍କୁ ଦିଅ ଭାଇଙ୍କୁ ଦିଅ ଗୋଟେ
round of applause, please. My dear physios, we have 2 more talks. Please wait and also certificates and your gifts, please. My delegates, not physios. Sorry. So now I call upon Sri Rajaram sir. He's a senior journalist, sport journalist. He is the writer of the Indian Olympic team, and I'm proud to share that he's one of our jury of the SSI Sports Awards. And now we are going to be more working together. Thank you, Raja sir. Please, it's a privilege to have him. He takes out time from his busy schedule. He's a very senior most journalist, his words are really taken very seriously and proud to be here. Change the backdrop. It's okay. Bhaija. Next, I'd like to call upon Dr. Sajid Prabhakaran sir, as we all know, is the president of the group, and we have already done a big introduction of his new society. Sir is also one of the most known face in the football world of Indian football, so we all should proudly support his group so that he can create more job opportunities and other things for us. The replica what you see is our famous Konark wheel, and we are proud to give to our faculties. Now I'd like to call upon Professor Mahamaya. One thing she is from XMD. I heard she has got a new position, the student counselor, so next time we expect more participation from XMD and management students. She is my junior in school, and I'm very proud to see what she's doing today. XMD I've always seen from outside boundaries, and she made me possible to enter the boundary for her. Thank you very much. Mahamaya, proud of you. Now I'd like to call up Dr. Saurabh Mandal sir to kindly be on stage. He's a sports scientist, sports expert, sports medicine, got multiple publications, works with the Odisha state government, and when I started this journey of sports science conclave, he was very much instrumental in helping me. Has always been asked, like, he said, I'm available. Thank you very much, sir. It's a privilege to have you again. Thank you very much. Now I'd like to call upon Dr. Amit Bandopadhyay. Amit sir? Okay, I think he's left. Now I'd like to call upon Professor Dr. Bhaskar Vasu from XMD, a senior professor and with lots of experts in sports management. It was very nice to listen to a talk today. I'm looking forward to more. People are interested. Sir has some very good plan in his mind. We should reach the XMD University to work along with them. Thank you very much, sir, for giving me time and sitting till the last moment. Then I'd like to call upon Dr. Sunita ma'am. She's as you all know, she's the senior most dietitian and have got certain official felicitations with the IPEN. Thank you, ma'am. She's the senior counselor in Apollo. We have already heard these introductions. Now I'd like to call upon Shri O.P. Singh ji, our Olympian, the national record holder, shot put thrower, proud moment Arjuna awardee for being part of the Sports Science Center Conclave. Thank you very much, sir. Sir is also with the Indian Olympic Association, holding the office bearer post. It's a proud moment for us that he is among us.
चलो जल्दी जाओ सर देख क्या सर भाई ना दे जा सर दे
Now I'd like to call upon Dr. Anjana Tripathi, a senior dietitian. I'm knowing a lot of dietitian this year, and ma'am, pardon me if I'm an incomplete with all the KWT and designations, which I'll be president of the Indian, I think, or what is it, that secretary, European secretary.
बता दे क्यों नहीं मुझको
Dr. Vijay. Now I'd like to call upon Dr. Vijay Damodaran. Okay. My next favorite and one of the most prime person we have over here, sir. I'm very proud of this gentleman. A very future, I say myself and him in somewhat. He is Dr. Chaitanya. He is one of the favorite mine. I'm very proud to say he is presently with the ISRO. He's a doctor in ISRO groups. The spaceman for me. Thank you, Dr. Chaitanya, for coming. I had to send a personal letter to ISRO to get him over here. So it's a privilege, Chaitanya, to be here. And a big round of applause, please. We have one ISRO guy for over here. This is a big thing. Chetan, I want you to speak one word, something, one line, something.
Hello, thank you, Sarthak Patnaik sir, for giving me the opportunity. Actually, I want to say in the beginning also, like, I am very fortunate to get opportunities. Before I was working in a JSW, now I'm working in a ISRO. I must say, I'm fortunate to work in all the things here also. Like, I'm very happy to be in this place and also sharing the stage and the dais with you, all of you. Thank you very much.
Now I'd like to call upon Dr. Subrat Dey. So he's a professor in the Sri University. Thank you, Professor. He's a very international faculty, got a lot of publication and researches, and one of the senior, actually, assistant professor in the Sri. How many Sris? Two Sri. Okay. Now, how many Sris are there? Sri University. We learn every day. Thank you, sir, for a valuable time. Now we call upon Dr. Kesav Ranjan Devi, a strength and conditioning expert. I think he's one of the prime guy I know, a very expert, and presently with Sai. Now I call upon the Secretary of the Indian Hockey Association of India, Sri Harjindran Singh Jindi, to be felicitated. Jindi sir, please. Ice hockey, it's a proud moment for us that he is among us in the Sports Science India Conclave. Jindi sir. Hare kuch nahi sir. So Jindi sir, I was telling yesterday, is the man, what you are seeing today behind ice hockey, men, women, under 17, under 19. Is the tiger, lion, you name it, anything, the man who gives everything for the nation and for the ice hockey sports. You should listen him roaring on the ground, and then you understand what कौन माने सब भाग छिप जाते हैं, including the opponent players. Now I'd like to call upon Dr. Gayatri Upasana Acharya. Gayatri is one of the consultant and professor, I think, in the ABT, Abhinav Bindra, Absmari. I always get confused with both this organization. But thank you, Gayatri. For me, she is one of the oldest sports physiotherapists I know, very intelligent, very dedicated and very particular. We always want the perfectionist, I would say. Thank you very much, Gayatri. Thank you. Now I'd like to call upon Dr. Balakishore, a senior consultant HOD of Some Ultimate Hospital. Bala is also a sports physiotherapy, a very decent man and very humble, always been supportive, both Bala and Gayatri, to bring all of you in this platform. Thank you very much. I'd then like to call upon Dr. K. Ganeshan, who is one of the head in administration. K. Ganeshan, the administrative head of ABT Absmari. Ganeshan is one of our senior sports physiotherapist who has worked in my institution, that's also one with Dr. David Rosen. So he was like the man who David Rosen like blindly believed, and I was very sad, surprised to see him when he joined ABT. Thank you, Dr. Ganeshan, to be again, to maintain this friendly relationship and standing along with me again. Guys, he has a very nice talk on taping. We all should listen to it because I learned many things from him. Then we have Dr. Aniruddha Karekar from World. So he's a sports physiotherapist. Dr. Aniruddha? Okay, we have one speaker less than. Good. Then we have Dr. Alpesh Jadhav. Alpesh, a SNC guy, a senior expert in the strength and conditioning, presently with the Naval Tata Hockey Academy. He's going to climb new heights next month. He's going to work with Inspire Group. Alpesh, I expect when people reach up to you from this conclave, you should help them also and support them. Okay? Thank you very much, Alpesh. He has a very nice talk. He's going to give load monitoring using GPS. So we have 2 more talks left, and then we'll finish the session. Thank you very much for all the faculties and speakers. And last and not the least, Madam Somika. Somika ma'am, yes, the backbone of this conclave, all the text, all the content, all literature, everything. I think the press man, the press lady, and one of the best moderators we have seen. Somika ma'am, please be on stage. I'd like to call next to 2 budding journalists who are good friends, which we will be seeing all these articles. One is from Kolkata, and other is from Delhi, and both are, I think, are going to the future sport journalist officer. आप देखिएगा ये दोनों बहुत अच्छे कर रहे हैं, but मेरे से मत लीजिएगा, राजाराम सर बहुत जोर से सर हिला रहे हैं. So Ms. Sohini and Mr. Vishesh, Vishesh, please be on stage. Thank you for coming from all the way from Kolkata and Delhi to be part of this conclave and being the supportive completely. अच्छा जाओ. And we have one senior journalist who has been supporting and was part of my team. Again, I like to, because he has been many sleepless nights, is Mr. Vaibhav. Yeah. Vaibhav is a new entrant in my team, sir, and I'm very proud of him being part of this conclave. I'd just like to call Pragya, Karishma, Suchi, Susri, Shri. अच्छा और एक श्री है. Okay. Anshuman, Lipika. Because our guest will leave, so I'm just finishing it so that once the talk is over, we don't again bother ourselves. Subhadra, all be on stage. On stage. Akul, chalo. Sandhya, Prabhasini, be on stage. The person who will completely be in this, starting from the ID card, the file, the magazine, the scoop pens, the lost ID card which you have used and somebody has not gone there, the reason behind it. The agenda, the team, my team, and then just imagine we don't have any event management. These girls in this team made it possible. Have been struggling from last. Where is Lipika? Lipika is, come. And Prabhasini, why don't you go? Prashanti. I am bad in remembering names. Apologies. Okay. Vanshika Patnaik. Vanshika. A round of applause from Vanshika, my daughter. She did a phenomenal work yesterday, sir, in the sports award ceremony, the MC, and the real content maker of everything. I couldn't thank her yesterday, I was so busy, I thought, let me now this opportunity. So, that's my elder. Thank you very much, sir.
Nirmal, Vishay, right? Just a group photo. Right, come. We just having it. So we are the man. We are the Thank you very much. Last word from Prabodh bhai.
First, I like this, sir, or yeah, please.
Good evening, ladies and gentlemen. Wonderful event, wonderful exposure. I am Group Captain Suri. I'm the Chief Operating Officer for Athletics with the Department of Sports. Retired after almost 34 years of service in the Air Force. But what is very important is, like many of the speakers also highlighted, that sports is one thing that it has to be part of your life till the time you die. So it is very important that such people, when I say such people, the gentlemen who are standing to my left are those kind of people, and the people who are sitting in the audience make this thing happen. that sports becomes an integral part of our life. And I'm sure the way and the methodology Dr. Sarthak and you all are putting in this environment, we at the field, since I'm handling the field, I find that sports is exponentially growing in our country, which is very much required. I take this opportunity to thank each one of you, Dr. Sarthak and Mr. Mohanty, for making this event scale higher and higher with each year going by. Thank you very much, and Jai Hind.
Thank you, Mr. Suri. Thank you, my brother Sarthak. And thank you all, the sports scientists, the players, and ladies and gentlemen. I have been associated with this event, SSI, with Dr. Sarthak. He is actually a younger brother to me from its inception. And unfortunately, this time on the opening ceremony, I was not here. I've been in Pune for my nephew's marriage. So I missed the literally glittering and successful opening ceremony and our ceremony yesterday, where all the galaxy of Indian sports, even the state government acknowledged that so many awardees are Indian national players congregating at one place is rare. So it is happening. We wish to take this SSI event national. We plan it to take it to Delhi, maybe next year or in future. I wish Dr. Sarthak all the very best, as our organization, Mr. Session Mohanty Group, will be associated with this event for in future also. We'll take it forward, we'll make it national event, and with all your support, with the support of all of you that you have come, all the participants, all the speakers, we'll actually make it a world-class event in future, so that our state, Odisha, will be recognized. Already Odisha is recognized as the sports capital of India because of the holding of back-to-back world hockey and other events. So we look forward to seeing much more good times in future. Thank you all. Thank you very much.
Thank you, sir. Thank you very much for your time. I'm very thankful, and it's really a pleasure to we have Prabhat Mohanty sir and bless us with this, and we will surely make it not only national but international one day. Thank you, sir. So we'll just continue with the last two talks. Ganeshan sir, please, and Alpesh. And we have one case. Okay. Thank you. Thank you, sir.
So, good evening all. Thanks, Dr. Sarthak sir. Sarthak sir is from Ortho 1, where he did his fellowship, and I was there for about 10 years. And it's always nice to be associated with anybody with Ortho 1. And I find wherever I go, I meet any of the orthopedician. Mostly I find an orthopedician who's come from my institute. So that's always nice. So, after a movie, there is always a post-movie credit. Sometimes that's the most interesting. So now I feel that we don't have any pressure on the time or other things. And post-credit, I can give you some information which could be interesting. So sports taping, primarily, if you divide, it is preventive taping and management. So if you have an injury, and one is preventive. So on field, what you need to do is you need to be able to do a quick assessment, try to have a possible outcome effect. That means whether you're going to have a control on the pain. Most of the time when you're in the on-field, pain is never a problem because their hormone levels are high, pain tolerance is high. The only primary concern for me will be instability or any laxity or joint going in for subluxation or dislocation. Then you need to continuously monitor. So maybe every 5-10 minutes, just keep a check. You don't ask the player, but keep a check. Then the material what you're going to use, that you will have to know whether it is durable enough. Off-field taping, you will have to know whether there is a pre-existing injury and what is the injury recovery process, whether it is in the stage of inflammatory or it is remodeling or granulation. So you will know that what stage of healing it is there, and based on that you will have to think how you are going to work on your taping. Then whether you want to do a preventive taping suspecting the player having an old injury, or you want to do a taping specifically to improve the performance.
So
I hope everybody will be knowing this. So when you see this, most of them will think, wow, what a taping was done. But ultimately we came to know that it's got nothing to do with taping.
स्लो डाउन हो गया, क्लासेस वहां पे वेट कर रहे हैं कि भाई कभी मैच शुरू होगा, कभी मैच शुरू होगा. मुझे नहीं लगता कि वही हो सकता है, पर एक रीजन हो सकता है कि हमारे पंच साहब ने दिमाग लगाया और थोड़ा सा.
So it is acknowledged that it is not the reason, but it could be one of the reason. Okay, but everybody said that, yeah, that could be one of the reason. So if people remember this is Virat Kohli played with 8 stitches in his hand. Now again, this is not to do with taping, but it is only the strapping, okay? And when your level of mental strength is high, you will go about. And the important thing in this match, it was a very crunch match where they have to win to go into the playoffs. And he hit a century in 47 balls. And that is why he was showing his hand. So I think this is 2012 or 14 Euro final where Portugal made it to the finals and they won it. And this is the injury, probably MCL grade 2. And you can see that immediately he's been wincing of pain, and whatever pain tolerance you have, some of the injuries, you cannot overcome that. So they do the strapping and Ronaldo gets back onto the field. And he tries to run, move, and you will see that the pain is so bad that he just gets back and gets off. So you know that every time there is not going to be a solution that you will be able to achieve just by taping. It's not going to be your solution for everything. 2002, this is the year when I was completing my master's in sports. I don't know how many of you would know this incident. This is Anil Kumble taking a hit from Ian Bishop, and that's his mandible that had a fracture. This is on day 1, and they've decided he has to fly back to India for his surgery. And the next day morning, we see Anil Kumble strapped and back into the bowling. And the reason why he came, you know, because Sachin bowled and he was able to spin the ball on the ground. So Anil said that I need to go back and try and do what I can do the best for. So this particular strap, when it was done by Andrew Lupus, he said the strap was so that he cannot move his jaw. And he was on the live commentary, he says that I don't know how he's able to appeal by shouting. That means what? It was not helping, but he was able to manage and go with the play. Now, you will also see in the interview where he says the initiation to play, or I want to go to the field, was taken by Anil Kumble, and then the decision making was a team effort, seeing that what is all to be done. So what are the principles of taping method? Structure to be taped, so you need to know as a physiotherapist what is the probable structure that's involved and what you're going to do. What is required in the structure, whether you're going to offload, you're going to do a compression or change in the direction for the forces. Then what is the position of taping you want to do, whether you want to keep it in an abducted position, flexion, all those things. Then you have to have a quick understanding of the biomechanics and the probable pathomechanics if there was an injury. You also need to know what are the force production of the muscles around them, which is going to affect with your taping, and then the other joints allowed as part of the kinetic chain. So what are the schools of taping? You have the athletic and mechanical taping, then you have the kinesiology and dynamic taping. These are the broad classification of the taping that is available. And the benefits are probable pain management, muscle activation, positional fault, inflammation, where you can try and control, and posture correction. So these are the various tapes that is used, and you can also get in various sizes and various colors depending upon the sports rule and all those aspects. So this is broadly how you can see what you can do with the tapes. So the red ones are your rigid tapes, which can be used for joint support or correction. And the meconal one could be a very strong mechanical correction, what you need to do. The difference between the athletic tape and meconal is the amount of glue and how much it can sustain. The rigid tape, athletic tape, which is commonly called, the glue is okay, and it is lighter on the structure where you can just quickly put it on a sports event. With the sweat, it can absorb and hold on for about an hour or so. But the meconal tape can stay for about 24 hours. But that cannot be done on the sports field, or you have to have a quick dry, have a glue spray and then do it. Kinesiology taping, again, I don't use it on the field because it is not going to give any effect. It has to be done pre-event. Dynamic taping also the same thing. So how can you use the taping in various stages? In acute stage, you can use the kinesiology taping where you want to do the removal of exudates. So there is an inflammatory process and you want to do removal of exudates. Rigid taping you can do to restrict the movement. It's not going to completely immobilize but restrict the movement. And you can also use the kinesiology tape on the muscle to sustain and maintain the muscle function. Now once you start the healing stage, or when the patient's healing stage has already started, you can use the kinesiology tape to sustain the muscle facilitation. You try to use it for proprioception. Use the rigid tape during exercise session or prevent fear of re-injury. So you use it when you're trying to do a loading mechanism of close kinematic. Then on the return to play or starting to do some competitive activities or exercise, again you will use the kinesiology taping to maintain the muscle function, add proprioception, and the rigid tape can be initially used in the practice session to control the movement and take the fear of the athlete. Rules, shooting does not allow the taping to be done, so that doesn't mean you don't tape your shooters. When they have an injury you can do. It's only during the competition that taping is not allowed. NBA, earlier it was banned and they said it was allowed to be on an experimental basis, and now they say that yes, you can use them particularly on your arms and shoulder, and it should be a solid state color. It cannot be some fancy color. Swimming, it is banned because they say that it can give you undue advantage on this. Now the rule is that it is approved only on the basis of the referee. He has to make sure that it is only a preventive or injury management and not a performance enhancement. Joint position sense in archery, again it has some studies say that it can be helpful. So I don't know why shooting is banned and archery they have not banned. Ideally they should be banning that also. And there are studies where they say that how it can help you in ankle instability, in basketball, acute injuries, dislocation, all those things. Now the evidence and if you ask the taping can be an evidence-based. Most of them, if you go and look at the research, there will not be a very conclusive one. Why? Because every injury, every athlete, every therapist who is going to go do the taping is going to use different materials, different methods. There is no textbook. Now when you see Anil Kumble being taped, there is nowhere in the textbook. That's the first thing where somebody has to do. So you are not going to have an evidence. Only thing is your rationalization, how you understand the biomechanics, how you understand the injury, and then you need to go about. You cannot be, I would not call thinking out of the box, but you need to think within the framework. Thinking out of the box is stupidity. You have to think within the box, know your framework and work within them. If you know it's not going to work, back off. You will find on the internet so many designs of tape. Sometimes there are irrational, unexplained methods of taping. So you need to be very careful on that. What are the adverse effects of taping? You can injure a patient by doing a wrong method of taping. These are skin lacerations. So you have to understand the structure of the skin, how soft it is, whether it is going to be moisture or the movement of the skin. When you are particularly looking at the shoulder, you will have to know what kind of a movement he is going to do, what kind of a movement the skin is going to be. Already is the skin stiffer for him or very lighter? Then you have to know earlier if you have done any taping, does he have any allergic reaction? So you will know based on that how to go about it. Then rigid and kinesiology are the most common tapes where they can have these kind of effects. Then how long you have been put the tape to use. Then the movements around the area, that is the skin and the joint. Okay, this is a case study. What's the problem? Now you see I have taped this particular person on the rhomboids and the lower trapezius. So you find that this guy might be having a shoulder or a scapular problem. No, this guy was a low back pain whose compensation was because of his poor opposite side shoulder weakness. Okay, he's a hockey player. So this is a surface EMG, what I have here, and I can find out that there is overworking of the erector spinae, and then based on that I facilitate the scapula muscles. Now that fires better and the loading on the erector spinae decreases. So this is just a surface EMG, how I use it to diagnostic and to teach the player. This is a patient with quadriceps issue where they had tendinitis and improving on that. So I've done a combination of kinesiology and the dynamic tape. So if you see the tape of the dynamic, I've got 3 strips over here. So the component is getting the kinetic forces in the mind, not just the quadriceps muscle as a structure. So I want 3 forces all combining together to go down and add that force component coming from the quadriceps muscle. This is patellar tendinitis. So first is working on the insertional tendinitis, getting a good support from the kinesiology taping, and then controlling it with the dynamic tape on the quadriceps muscle. This is contusion post-football game. So you can see the amount of contusion and pain. So we do a lymphatic drainage towards the groin lymphatic region. And this is the 3rd day. You can see how there is a decrease in the contusions. And one more tape. That's it. So this is my early days of taping where I had a patient of ACL tear. Okay, he's a complete ACL tear. And the only thing I said that we will try to see whether you're going to be a Cooper. And I was able to get the functional outcome in one session. This guy was based in the army. So I know that his motor component is already very higher. I just need to kick in the neuromuscular component and see whether he can become a Cooper. I have this guy whom I followed up for 5 years, 3 MRIs done, still he is an ACL deficit guy. But he's a Cooper, able to manage and still go on functionally outcome. So the kinesiology taping at that stage was only able to facilitate the muscle, get the neuromuscular kicked in, and I was able to take him into the exercise program. This is hamstring injury, a hockey player of mine during my league. So he's just recovering and I'm getting him back. So you can see that this is more of the biceps femoris that was the affected one. So I have a support space technique on the kinesiology taping at the upper tender spot and the lower tender spot, short fibers. And this is just to facilitate the muscles as a muscle technique. Sometimes they also work as a psychological effect for the players that he feels there is some kind of a support. Whereas I know that structurally it is not going to be a big one. And clinical examination before this is very important. You should know your concentric loading, eccentric loading, how much muscle is able to sustain and do, and then you go about it. This is a patient who was a hockey, again my hockey teammate, defender, back-to-back matches because we were traveling the same day and then began the another day match. So having a little bit of stiffness on the back, so I tape him on the back for the second match so that he can have less spasm and then he can complete the match and get back to the next game. So this is Brent Livermore. He's a 3-time Olympian with the Australian team. So he was part of our team at the hockey league. Now we had a fracture at the 3rd metacarpal and it was an incomplete fracture. So it was inside the webbing and soft tissue support was there. So the doctors in the team, they said fracture, better not to play. So the call was between the player, myself and the coach. So the player said, what do you think, Ganesh? I said, you have already played one game with the fracture, which we did not know, and then we suspected we do. And then we looked at the pros and cons. I said it is within the webbing and it's incomplete. At the most, it can become a complete fracture, but within the webbing, it's still safe probably, and it might not be an open one. So we took a call as a team discussion with the captain, and the important thing for me was this guy being an Olympian with Australian team, he knows what I'm trying to do, and his wife was also a physio. So the decision making was easier, and I had to make a strap with a gel pad inside and a fiber cast where I was cut it open, made it specifically. The most important challenge was to get protection and mobility. And in hockey, he needed his wrist to be particularly to move as much as possible. And I got that thing done. And then what we did was we did a reassessment during the game warm-up. And then we did a re-evaluate during the halftime. So I wanted to make sure everything is good. So we were able to go through with the 2 games without any problem. These are some of the on-field ones. This is with a basketball player. This was a Nigerian player with the inter-university at SRM University, but based in Coimbatore for a tournament. So he just dislocated and he needs to get back because it was a semi-final or thing. So it's just a rigid tape, how you want to just support it and put him back. This girl, Amrita, was an old ACL patient, recovered, but she has chronic ankle instability. So just before the game, I just put her on a good strapping for the ankle and then put her back in. So what is your take-home message? Understand the mechanism of the injury, probable structure. You cannot be very precise, just be probable, maybe try to be as precise as possible. What type of taping material will be required? Sometimes you might not have access to all the material, but know what you're going to do with your material. On-field and off-field taping is different. The thought process is completely different. Duration of the game left and the significance of the game at the moment again has to be decided. If your tape has to be there just for about 10-15 minutes to make him play, that's a different ball game. Then understand the basic concept of taping and the pathomechanics involved. So there is no hard textbook rules which says how to do taping on the field or for the injury. But off field, yes, we can have certain guidelines and you can work around. Psychological influence in rehab and on field, yes. Sometimes players don't want to show their tape and injury during the field because it gives the opponent psychological advantage that he is having an injury. So you have to understand that and go about it. So thank you about it. If you have any questions, I can quickly take them.
Thank you, Dr. Ganeshan. I am a big fan of taping, being a sports surgeon and everything. So the prime role is always to send the player as soon as possible. So taping role is primary when you're on field is to immobilize and try to do the maximum so that he goes pain-free and at least give a confidence boost to his players, other team members, and himself. And secondly, on a rehabilitation, on your clinic setup, it is basically as a preventive or is mostly like a treatment protocol. So your taping is really important. Many of the doctors, even orthopedic surgeons and people don't believe in taping. You don't have to bother, who bothers doesn't bother. But yes, please learn the proper technique. Try to shape the hair properly. Tell the patient that when the hair regrows, these are the pain. Wet the tape before they remove it, because these are the things which make you more classy when you're in a practical field. Okay. Thank you very much, sir. Thank you for your time.
Thank you, sir.
Now I call upon Dr. Alpesh Jadhav, the load monitoring using GPS. And after that we have a research topic, just for sir, academics completely, especially Dr. Ganeshan and Dr. Gayatri. There's a senior physiotherapist who wants to perform and he needs more collaboration and thing. She's just doing, but she needs more collaboration. So just so that he will just discuss the topic. So if anyone need it for a PG work or thesis work or something, you can find some parallels from it. Yeah, Dr. Alpesh, thank you. So as I've already given a brief introduction about Dr. Alpesh, he's presenting with the novel Tata and is going to the Inspire group. And now he's going to inspire us with his talk on load monitoring using GPS. अपना GPS खराब हो गया यहाँ पे. That's his signature?
Yeah.
How much property you have?
Yeah, no. It's like that.
सब हो जाएगा.
So hello everyone. So thank you so much for staying back actually. I'll make sure I'll contribute as much as possible for you guys to staying back who is there. Thank you so much Sarthak sir for giving me this opportunity. Yeah. So I'll be talking about load monitoring by using GPS. So more than information on GPS, I will let you know how I work with the GPS. I guess most of the ABTP guys would have worked with me, being there aside me, and have worked with me most of the time. So GPS, before we go to the GPS, I would like to let you know a few ground rules. GPS is all about the data. Before even going into the data, you have to understand the game. So if you have a coach, you have to go next to him. You have to understand what he think about the game, how he think about the game. You have to see at least 2-3 matches. So apart from that, you have to understand players, how they play, how is their like physiological situation, how is their movement patterns and everything. Once you understand everything, then you will go to GPS, because most of the time data might lie. You will understand something and there will be some other situation which would be happening in the ground. So, yeah, back. GPS is nothing but one small equipment which will have these 3 equipments inside it, which is accelerometer, gyroscope, magnetometer. So accelerometer which will understand what kind of a movement which is happening, how much meter you are covering, all those things. By gyroscopes you will understand the rotations and tilts. For example, if you are a goalkeeper, you are diving ahead, like diving on the right or diving on the left, it would be able to understand which exactly direction you are going into. Magnetometer, it finds the direction. This all 3 including together, it will be a GPS equipment. Next. This is not part of a GPS, though we can add it with a GPS. You can get the vest of the GPS. With the equipment of GPS, you can use heart rate monitor also, so that we can get an accurate data, which will help you with the internal data as well as external data. So why we have to use GPS? So it will confirm the training intent. So what training exactly we are going to do? Are we achieving those targets or not? We can share it with your support staff. We can share it with your coaches. Then we have show matches relevance. So the way I said before, even using GPS, you have to see at least 2-3 matches so that you can understand what is happening in the ground. If you go into the ground directly with the GPS, if coaches ask you what is happening there in the GPS tablet, you won't be able to answer them. Once you see the matches, once you understand movement patterns, what are the needs of the sport, you'll be easily able to do the interpretation. Without interpretation, GPS is nothing. So we'll be easily able to see the interpretation, we'll be able to give the interpretation, and it will be much more easier for us, coaches and support staff. Then we can highlight the under and over metric players. So every sport you would have seen, there will be few players who would be working out very like excellent. There will be few people which would be lagging. So we would be able to understand which one to work on, which one not to work on exactly. How we can improve their performance. Then we'll have support or role clarity. In one game, there will be like multiple positions will be there. Like for example, like midfielder is there, striker is there, defender will be there. Everyone might be running very differently. Everyone covers the distance very separately, differently. So on that basis, we can give the load to it. We can design the conditioning on the basis of it. So apart from that, better design of the drills. Any coaches who want to design the drills, or any SNC coaches who want to design the drills, so that fitness will arise. So by the GPS, you'll be able to give the prescription very efficiently. So you'll be also able to monitor the training load. What happens is, you'll be easily able to understand the periodization of the athlete. We'll be easily able to understand if athlete is having the overload, overtraining or not. On the basis of it, we can give the deload. So apart from that, so training load which can be prescribed by frequency, intensity and mode. So just like a small concept, internal load and external load. Internal load, like which is something which is happening inside the body, on the basis of which the load is prescribed. That would be internal load. There is external load, On the basis of things that we prescribe, how our body reacting to it, that would be your external load. So we have different monitoring tools. We would have seen this in the previous sessions. Internal load is done separately, external load is done separately. So different modalities are used so that we can get an understanding if athlete is performing better or not, he can be recovered or not, if he is injured, how we can get him back to the play. So these are few things which are used to check the internal load. So heart rate monitor, like everyone would have used it most of the time. The next one is one of my favorite. If anybody is trying to do research on it, any exercise physiologist, SNC, anyone, it would be the best topic, which will be NIRS. This will check how much oxygenation which is happening inside the body of the athlete. So whenever you prescribe any conditioning drills or anything, you would be able to understand if proper oxygenation is happening or not. On the basis of it, we would be easily able to understand also like VO2 max is getting reached or not. Not much of researches are there, or like not most of the organizations are using this. There is one technology which is called as RED, which uses like NRS. Might be like you can go home, read about it, or if you want to do a research, this would be like your best topic that you can check. Then yeah, blood lactate we check, VO2 max we check. SRP is nothing but a session RP. Athlete goes home, he rate himself, how much RP he was having, into like how much minutes he played, you will get your session RP. And some maximal test. So apart from that, there is EMG. Yeah, then we have external load. We check it by GPS, velocity sensors. So we also get few shoes which will have the pods. So by which also we can check the load of the athlete. Okay, so why we do this? Because let's say this is mostly done in team sports. Any sport that you want to profile on, any athlete will be running a certain distances. It will be different on the basis of position to position. Long time back, every athlete used to give the same prescription. Just to make sure it is not happening, we have to understand what are the demands of each and every position. There is a possibility defender might be running very less, midfielder running so much. Striker, rather than running, I should say he would be sprinting much more because he want to make a goal. So on the basis of it, like prescription would be done. If coach and SNC would be like so much of blended together, then they can create a very good prescriptions. They can create very good periodizations on the basis of GPS load, better performance. So it is obvious, like I'll tell you most of the time what happens in the matches. Let's say we have 4 quarters. Quarter 1 athlete will play good, quarter 2, quarter 3. Quarter 4, like almost they will be fatigued. Why they are doing it? Because if the opponent is very good with the fitness, we are not able to sustain to it. Why? Because we are just dragging ourselves so that we can make a goal, but we do not have that much of fitness. If we check what are the loads which we are having, we can improve upon it, and then we would be able to sustain for a longer period of time without having any kind of fatigue, and also performance will be better. Then fewer miss session. So what I do normally, like we use something which we call it as AMS, Athlete Monitoring System, wherein we combine several different type of technologies such as force plates, heart rate monitors, and GPS. We will understand like if athlete has recovered or not by the jump height. We use force plate for that, so that like we will understand athlete is recovered or not. If it is like a GPS, we use dynamic stress load. I'll tell you what is dynamic stress load. Let's say we are a marathon runners. It is a 10-kilometer run. Let's say in the end of like last 1 kilometer, athlete want to run, but still his brain is not responding to it. You might have heard something called as neuromuscular connection. When your body do not have fuel for it, your brain will not give signal for it. So same thing, something happen in the team sports, which we can understand by checking DSL, which is dynamic stress load. What happens is like you will see athlete want to give his like better performance, but he won't be able to give it. Just because like he is fatigued from here, he won't be able to do all those movements. Then we have lesser injuries. Yes, obviously, because we would be able, injuries most of the times happen when your brain is not connected with the muscle. So that is the reason movement is not proper. Most of the time, on that time, like he will do some kind of a wrong pattern and injury will happen. So by this, we avoid the injuries. There are 4 different type of metrics that we get out of the GPS. One is distance based, like what kind of a distance he is running, in which first one will be like total distance. Then we have zone related metrics. There are different type of zones, 5 zones, starting from walking till like high sprinting. So on that basis we check it, but which one to choose is the key. You have to be in the system for a little bit of time, and we have to understand which matrix will be proper, and we have to prescribe on the basis of it. Then we have speed and acceleration metrics, then in which we can understand how much speed they have, on the basis of which conditioning will be prescribed. Sprints, acceleration, deceleration, what is the acceleration deceleration ratio, on the basis of it, which we can also define if injury is going to happen or not. Load impact. So DSL, I have already told you guys, impacts is something in the contact sports, how much impacts they are getting. On the basis of it, we can also do another prescriptions. HMLD is high metabolic load distance. When your heart rate is on like very high note, in that exact area, how much distance you are covering. That would be a high metabolic load distance. Then you have heart rate based system. In this you will get to know what is the heart rate zones. On the basis of heart rate monitor also you will get to know if athlete is performing better or not. Nowadays it is little bit difficult because athletes move a lot. If you have seen the strap, because of sweat it will go down. So we use the vest. On the vest itself the heart rate monitor will be there. It is very easy to monitor the performance. Can you go back? There is something which is new, which we call it as a TRIMP. Maybe I'll not talk it here. You just guys go ahead and read it out at home. We use resting heart rate and exercise heart rate to understand if athlete is recovered or not. If you do this, we can easily, avoid the injuries or anything. Injuries, fatigue, so many things. So this is just a homework for you guys. Next. So absolute and relative metrics. So absolute metrics, we have to understand when to apply absolute metrics, when to apply relative metrics. What are the demands from the coaches? Exactly what level they are on? Are they on the grassroots level? Are they on like intermediate level, or are they on like elite level? So relative is something in which we will give everyone different metrics on the basis of their position. Absolute is something wherein you will give the same target to all the athletes. So if you'll see all the metrics, they will look something like this. Okay. So it will look something like this. It looks all the numbers, but it is very important that you should do a proper interpretation. For this, it is very important for you to have a load monitoring concepts understanding. So this is how it looks like, the whole team performance. Next. So this is how the speed spikes will look like. The blue things that you can see, this is the speed which you can see. On the left side you can see the speed meter per second. By this you would be able to understand on what exactly time period, what exact sprint speed he would have gone through. Next, and stop. So this is where we'll understand in exactly which zone athlete was actually traveling. So starting from start point till the end point, zone 1 will be walking till the end. Zone 6 will be like very much high amount of sprinting. So we can profile all the athletes and we can understand exactly on what time, what demand each and athlete need. Okay, this is how we can understand heart rate recovery percentage. By this we would be able to understand if athlete is recovered or not. But if we do it little bit prior by checking resting heart rate of the athletes on everyday basis, we would be able to avoid this also.
Dr. Meenu.
Can you click on that, data analysis? Just click it. No, data analysis. There is a link to it. No? Okay, cool. So it's okay. So once everything is done, then it comes to the data analysis. We get a huge amount of data, and this is where AI comes. AI is not to give a burden that what is meaning of the data, but to understand what is the meaning of like huge cluster. If I have 2-3 athletes, I can understand. I can do it very easily. If it is like a bunch of athletes, it is very difficult. Either you should have understanding of programming or machine learning, any one of it. So that is my next goal. I'm going through it right now. So once you understand everything, then you would be easily able to give a proper amount of prescription. I would not say prescribe it, like use GPS for grassroots athletes, let them develop. This would be done mostly into the intermediate and elite athletes. Apart from that, try to use different technologies, data together to come to an outcome, so that you would be much more perfect with your solution. So, is it from my side? Anybody have a question? You can ask me. No question. Thank you.
I have one question.
Yes, sir.
Why are the GPS systems so expensive, and can't you guys come up with Indian innovation where the cost be bit slightly in a reducible rate? Because it's very difficult to afford certain GPS things. I think this the Galore group are coming up. I think with you people, you should tie up with them and come with because Wald and certain companies are there, though they are also part of the sponsors. The price is too high. It's not possible. You have to create a product which can be easily accessible by all physiotherapists in your field. Because I took around 2 years to get a product of Wald, because I was thinking it's not about the money to buy, but it is how practicality related to get the money back or the patient's mentally to understand. So if you have, your team should come up with something. Vijay is there, he's one of the, I think, senior most biomechanist guy, and should come up with something, on all this GPS.
Sure.
And I know few more companies who are doing in Belgium and Netherlands and Ireland.
Mm-hmm.
If any one of you are interested in any research with them, I can connect you with them.
Sure.
Okay. Thank you very much.
Thank you.
So you have inspired. So if somebody apply for a job, you should also help them.
Yeah, surely. Anytime.
Yeah. Okay. Thank you. Now, the research part, I would like to call Dr. Menu.
Good evening, everyone. I will just take 5 minutes only, and due to time constraints, I will share my practical experience only through this rehab case, that how objectivity is important to bridging the gap between coaches and physios. So we have encountered an injury. A triple jumper elite athlete presented us with the Vosters Intermediates grade 2 strain. The first challenge I found, there was no data on the Vosters Intermediates. That's why that motivated me to write this paper. Because we can see rectus femoris injuries more common, patellar tendon injuries. Then what we did, how we approached, the objectivity I'll talk, the assessment, the practical assessment, how much pain it was on VOS, we took the data. The part of the injury from ASI is how much centimeter below everything, and we presented to the coach. Because when it comes to return to training, coach wants their athlete not next day, immediately next second back to the training. So mostly we were juggling to make them understand that why we need to take off athlete from the training. And for further investigation, we went from our sports medicine doctor's suggestion that we will go for the ultrasound imaging, and we found the grade 2 injury. Then the sports science team, high performance center team, the sports physician, physiotherapist, and everyone sat together and just explained to the coach. And the third day, we started the pool rehab with the athletes. So again, the question came from the coach side that, okay, he's doing everything in the pool, so why I can't take him to the field? Then again, we explained the factor of the buoyancy and how weight is deloaded in the pool. Then we rehabbed this athlete. Within the 4 weeks, he was returned to training, and he achieved the best. That was near about 17, the triple jump distance. Then after first week, early we started the isometric multiple stimulus. That is my favorite exercise to give, not with the 10-second hold, with the 45-second hold. Then again, after first week, coach approached us. Okay, now he's doing everything with you, the leg extension, hip work and everything. He's doing other part of SNC. So why I cannot take him back? So it was consistently not the my effort that I was worried that we will rehab him well, but concern was how to explain the coach, because every time they just want their athlete to take back. So practically we are facing a lot of challenges, but their objectivity came. So we did some testing initially on the walled equipment, the isometric data only. We presented him the difference between the right and left. Can we go to the graph of isokinetic? And lately, this was a conservative rehab, so the pre-rehab matrix of the isokinetic data, there will be graphs of the slide. Yes. So you can see this is like we took at the two speeds, 60 degree, 180 degree. So pre and post matrix, the arrow will show the decrease in the deficit. So that's how we explain to coach the metrics, that where our athlete stood before the rehab and now how much difference it was there and now it came to the minimal difference. Next slide, please. So this is the 180 and the next slides will present the interlimb, which was the injured sides, the pre and post data. So this is how somehow we tried to explain from our side that how sports science is helping, and as a physiotherapist how we are helping him to return back to the training. And we are glad that after that he achieves the season best and the personal best as well. But with my experience I will say that rather than resisting the coach's concept, because they are the one who are pushing technically and performance wise towards the medal. So it's a repeated process. We have to keep explaining them with the objectivity, not with the subjective data only. So that's why this motivated me to write this paper, and we were successful. Thank you so much.
Thank you very much, Madam Menu. And regarding vascular intermediates, ma'am, we have a paper by Gayatri and myself in which we have treated a grade 2 patient conservatively. It's there in, I think, in one of the index. So we also do conservative management, and I've been known in my faculties or most doctors in like that, okay, he treats maximum amount of patients conservatively than operatively. Because in SSI we have a footfall of nearly more than 1,000 every month, and not even 10% are operate. So, and I really thanks to Gayatri, my physios, Angshuman, Pragya, they have all joined new to me. And one of our very young girls is VPT, but she's one of the best, Shri. So I'm very thankful to them of my team.
I forgot to mention, I found only one paper, and that is, I think, yours only.
Okay,
that was my other paper. And now you can see the two paper. One is mine, one is Dr. Sarthak's. Thank you.
Gayatri, thanks.
Thank you so much.
Okay, I'll just like to felicitate Dr. Vijay ji. I'll do it myself, please. Please be on set. A round of applause for the biomechanics guy. You all should follow him. He's a great guy in your field. Hope to see you again with your new innovations. Yeah. Thank you very much. Thank you. And I'd like to call upon Dr. Minu, please come up on stage. And then Rohit Rathod. Enama, parena sir? Rohit. Sir. Rohit, be ready.
Thank you for remembering my name. Thank you for
You know the difference between all speakers and her? She called me up and said, I want to talk on a paper, a research paper. It was not a talk, it was a research paper. I was very happy that somebody wants to talk about a research paper in our field. And because that is where we have to give a chance. And I would love to have a session on poster competition, paper presentation, but involvement is required, ma'am. Next year, if with your support and Gayatri and Ganeshan sir's support, we should come up with something more innovative.
Thank you so much, Dr. Sarthak, for accommodating me last time.
Tambi, Mr. Rohit, enapa Rajnikant style,
was speaking to good Tamil.
Yes, Tamil. I love Tamil. I couldn't marry a Tamilian, but
No.
it's possible. Next one.
Next one.
Thank you. So we failed to put his workshop, but he's been still smiling and cheering. He promised to come back again. So when we do it, we are planning to do it with the Department of Sports, Ganeshan sir, Gayatri and all. I think I'll invite a special invitation to all the physiotherapists. We'll have a workshop along with the sports department. I'll try to do it on a Sunday And I'll make it free so that all of you can. Free, yeah? For
Free.
students?
Yeah.
Okay. Because they are charging me, eh? No. Thank you, everybody. Thank you for coming, and I request one by one to kindly come on stage, please. Or I will just, if possible. Thank you, everyone. I will just take 3 suggestions from all of you for the next year, because I know I can't be perfect. Everybody, God is not perfect, so I can't be perfect. So 3 suggestions from this row, this 2 row, and the last row. Okay. Suggestions. Vijay, Rohit, Ganeshan sir, Menu, Dr. Chetan, 1 suggestion. Yes.
Please extend the talk time, scientific presentation time.
Okay, so we need to have a scientific talk. Suggestions for you both line? Please.
Do workshops.
Workshops. You are from?
I'm from Nashik, Maharashtra. Abhinavendra College. That's fine.
Okay, great. But I'm sorry, Bhubaneswar.
Yeah.
Okay, sir? Ma'am? Thank you. Okay, ma'am. Come on there. Go and sit there.
So we can go for next year maybe a poster presentation with a theme, so that at least all students can work and they can come up with new innovations and new researches. But usually in other conferences we also do. I think you can take maybe 1 day or half day for only poster presentations.
Ma'am, we had this poster competition last year with a cash prize. Cash prize.
Waiting for the poster presentation right now.
Okay, so we had a poster in last year with a cash prize, but and we did give. This year I have put a notice, but I think I did exclusively by mistake for physiotherapists. That's my different. But next time I'll make it in general for all. Yeah, thank you, ma'am. Last row, yes, ma'am. Tejal, ma'am.
So make it for 2 days at least with some.
Ayo, 2 days. They are not ready to stay for after lunch. All sir, food over. We are going certificate, madam.
The thing is, the sessions are becoming overloaded for them. Na? So
And 2 days, how many of you will come for the second day?
with some anger.
Okay, how many of you will come for the second day? Okay, 3, 4. I am Babre. You. I will click a photo and send it to someone. Okay. Okay, I remember that much. Subhadra phone out. And yes.
I want from the dietitian team of Odisha कि water nutrition का part को हमारे sport nutrition को और थोड़ा सा lighten up करेंगे and we will have some more discussion about the sports nutrition part.
So we had given 3 talks and 1 discussion, but unfortunately the ethic of glitches to main speakers backed out and he couldn't come.
Yeah.
I'm very thankful that ma'am, hold her patient, and Anjana ma'am smiling on stage. मैं भी क्या करूँ कैसे उनको पकड़ कर उनको stage में when that the gimmick was going on with that from the conference slide, and she was still holding her patience. I know what the women's patience is. I am also married. But thanks you. A bit of clap for ma'am for being patient to us and really holding up and smiling till the end of the thing, because she's not irritated upon the time, but we as speaker, when we are ready to speak and this all errors, we get very irritated, not only on the slides but also on the management team who is holding it, because they won't blame the hotel. We as speaker always blame the organization which is doing it. Anyways, thank you very much. If any of you guys are interested for SSI, internship or observership or fellowship in sports medicine, sports nutrition, ma'am, we are discussing. And magazine, if any one of you are interested to put an article in the fanzine magazine, please feel free to put. We have a jury which decides which can be taken, but you are on the line. It's not that completely rejected. It's not a medicine journal. It will be rejected, but it will be done for sure. Thank you very much. Yeah, thank you. Okay, group photograph. Let's have a group photograph. I will sit here. You all can stand around and take. नीचे तुम लोग कोई बैठोगे या मैं ही बैठ जाऊँ? अच्छा, लोगों को बुरा लगता है नीचे बैठने में. Sir, please join us. Ganeshan sir, वांगो sir. तंबी, वांगो. Vijay sir, Talapati.
Okay, sir. Chetan sir, ISRO, spaceman. Bhai, Sumi sir, Sumi Patnaik, Vanshika Patnaik. Bhai, dear. And my SSI team, please don't sit like that. Please come, sir. Yeah.
Make yourself prominent. ठीक है? Make yourself prominent. Pakko इसमें current मारेगी. I'm looking. What's your name? कौन? तारना. Body builder. ओए, सलमान का फैन आ जाओ. तू सेपट जानी तू आगे ले. बॉडी ना दिसी बनी मैं पटर है. लाभर है बॉडी कहीं कर देते बड़ा. अरे ताकू नु चाहिए दिलू तू ठीक है चोड़ा है तुझे. Now you are taking your mobile. और ये स्लीप जाएगा हार्दिक पांड्या से सोई किम फोटो नेक्स्ट चेक किए सेटा क्रिकेटर था क्रिस गेल भाई मेरे बड़े भैया कहाँ हैं कम है ओके अंशुमन श्री प्रज्ञा हाँ प्रेजेंट है सुभद्रा प्रेजेंट को निर्मल निर्मल कहीं अच्छा हाँ भाई आ जाओ भाई द मैन बिहाइंड द शो a big clap for Nirmal please
he has spent more petrol than anybody.
Thank you everyone for coming. Yeah Akul Asun present है को पापा राव खड़े हो जाओ लाइफ का भी एक प्रेजेंटेटिव होना चाहिए आ जाओ हाँ बढ़िया कुछ ये नेक्स्ट टाइम कुछ चार्ज करिए जेवन नेक्स्ट आसिए विशेष ओके पेट अंदर दांत बाहर हमारे पोजीशन पे पोज दिया हाथ पेट ऊपर थैंक यू फोन प्लीज पास कर दो मस्ट मो गोड़ बिंद्राणी तीन दिन खाई चलो मत धरे दिलु इट लुक्स वेरी मोर फोन टा बदलो Thank you, MBT, thank you, Arsmari, thank you.